with this information session, we wanted to do something where we could get as many people as possible together on a Friday, end of the week. Hopefully some switchover of shifts are going on right now with the 4 to 7 session. What we wanted to do is get as many students together as we could, no matter what stage you're in. So if you've recently graduated, if you're in second year just getting into interviews, or if maybe you're even at the very beginning of your education and you wanted to see what to expect down the road, we wanted to kind of be able to facilitate any step that you're kind of at right now. So what we're going to be focusing on in this 3-hour session is really doing what we've been asked the most over the last 4 years. So we've been around as a company, as MedicSense, for about 4 years now, doing all sorts of stuff regarding hiring, provincial certification, private tutoring, things like that. So we just want to make sure that we can answer the questions that you might have, as each of you going through the interview process might be doing it for the first time, or you might be returning and you're not quite sure where you're going wrong. So we really want to make sure that we can, again, answer those questions, give you some examples. Today, we're going to be going through some scenario questions, see the types of things that they might be asking in these scenarios that you might be facing ahead, as well as implementing some of the new ALS 4.9 changes into those scenarios. So just making sure that you're kind of up to date on that stuff. And then for the second half, we have some of an interview presentation going on, as well as some mock interview questions. So today, all that we ask of you is to be interactive. We want to facilitate this, but everything kind of reacts and goes off of how involved the participants are. Because if you have more questions, it allows other people to kind of maybe feel like they can jump in and ask a question as well, right? Because that's what collaborative learning is all about. And yes, I know that some of you kind of feel like you are in a competition right now for some of the jobs that are out there. But in order to be the best candidate that you can be, it takes working with a group. It takes kind of learning from each other. It takes finding new resources. And that's why we wanted to be here and show you that we are a very valuable resource for you. So hopefully you get a lot of information out of today's session. If you have any further questions when we're done, you can always reach out and contact through the email that you received this link from, as well as on Facebook. We have our staff is continually monitoring the Facebook Messenger, so you can always go through that as well. We are recording this session. It did indicate that the recording is in progress right now, just so everyone is fully aware, full disclosure kind of thing. You can feel free to turn your microphones on to ask questions. You can feel free to have your camera on if you have any questions. Whatever you want to do is completely fine with you. Again, when it comes to the getting involved piece, as you guys saw on the original post, we are super excited to be working and choosing a random attendee who is going to receive a free I've Got Your Back 911 sweater of your choice, courtesy of the MedicSense team. Just we want to kind of make it a little bit fun. So get involved, ask your questions. When we look for volunteers, kind of jump in. I know it might be a little bit nerve-wracking. You don't know everyone who's here, but that is part of why we wanted to do this. A little bit of a break the ice, because when you're going through for your scenarios and your interviews, it's going to be nerve-wracking. You're going to be maybe sitting in the exact same position you're sitting in now, behind a computer screen. You don't really know who's over there. It's super nervous. Like you're super nervous. It's a brand new experience. Try and get out of your shell here and ask some of those questions and feel what that's going to be like in this super relaxed and controlled environment. Again, there's absolutely zero judgment here. We all just want to make sure that we can help you guys succeed. So of the team, only a couple of us are able to be here today because I'm not sure if you're aware, but there's this whole pandemic thing going on and there's a staffing crisis. So a couple of us did have to go into work. So sorry that we don't have everyone here for you to kind of pick our brains, but we do have a couple of us, myself and Joel. Joel's the other gentleman who has his camera on right now. And then at about 5:30, we're going to have our interview expert jump in and do a presentation for us, and then can kind of jump into that second half. So right now it's 5 after. So out of the 83 invitations that went out, we've got 21 attending right now. So some might transiently come in or jump in, jump out. It is what it is. And I'm really happy that you guys were able to attend with us. So let's make the most out of this. So I'm going to jump into a screen share here. Okay, does everybody see that presentation? If anyone can give me a yay or a nay. Okay, I've got a yay from Joel, fantastic. Joel, are you currently given powers of a presenter? Are you able to admit people and such?
I don't believe I am. I don't see anything coming up saying that anybody's waiting to be admitted.
Okay, so I just admitted one. I'll just continue to do that. I'll leave my cursor kind of over the admit area, so we should be all set. Fantastic, just to make sure no one's kind of on the outside looking in.
Just before we go, so I have 2 fur missiles running around. I apologize if you hear them in the background. I'll try to keep my microphone muted, and hopefully they won't interrupt if I am presenting.
Awesome. So puppies are a plus, so we get a little bit of them jumping in. So with this, again, what we're doing here, we have a general free attendance workshop. We're going to be going through some interview preparation stuff, some scenario reviews, as well as some of the types of scenarios you might see going on with this interview process. Obviously, everything's a little bit different with the pandemic still going on and different restrictions, and then some just general Q&A that will be occurring after the scenario portion and after the interview portion. So this should take about 3 hours or so, give or take. It's going to be based on how interactive we get realistically, okay? So what are we going to cover today, really? We're going to spend this first 10 minutes doing an introduction, which is what we're currently doing. And I'm going to give you a little bit of info on who we are and what we do. I'm going to go through scenarios. So you see in brackets, you have 2 sections here that are interactive. So with interactive, what that means is we're going to be looking for a volunteer, okay? So when we're going through the scenarios, we're going to ask for someone to have that bit of courage, have that bit of that eagerness to get involved and utilize this time to kind of maximize their learning. Because realistically, you're just getting time with experienced educators and time with people who are here and ready and willing to help you out, okay? So we are going to jump in on that. And then after the scenarios, again, we have Q&A. So just any general inquiries you might have based on where you're applying. If you have anything that's come up in terms of rideouts or you had an interesting call and you wanted a clarification or a question or anything like that. After that, we'll get into interview presentation. So that's going to be about an hour going through the few different types of interviews we see. So MMIs, panel interviews, some tips and tricks for virtual interviews and in-person interviews, depending on what you might be invited to. And then after that, there's going to be more interactive. So enlisting you guys to get involved again, some mock interview questions. So after that, going to do some additional Q&A if there is anything at the end, and then give you guys a little bit of more of a breakdown of what we do, what we offer, and how you can get in contact with us if there's anything we can offer you and help you out with in the future. So who are we? Well, Medic Sense is a company that I started about 5 years ago now in the spring. So it's been 4 full years. All of us are fully certified and working paramedics within Ontario and within Canada. Okay, so everyone has a AMCA that's going to be instructing you and answering your questions. Everyone's working and certified under a base hospital position. So we know what we're talking about. We work on the streets in the front lines. We're currently getting all of the updates through the Ministry of Health, through the Ontario Base Hospital Group, and through each of our governing base hospital organizations. So what we want to do is make sure that we can relay that information to you and assist you in the best ways possible. So our team, it consists of myself, Kyle. So this is my company. I started it again, like I said, a few years ago. I'm currently an advanced care paramedic working with Niagara EMS. I've been there for coming on 7 years in May, worked as a PCP for 6 of that. I just recently received my certification and switchover. I got this all started as a thing to kind of help out some friends that didn't get hired the first round through. So it came from just practicing scenarios and spending some of my newer found money with the career income on buying some equipment and making sure that we can all kind of get together and just do it. And in realizing that that really didn't exist anywhere else, I kind of opened it up to some people who weren't necessarily my friends, but also were looking for that same kind of assistance. And it just kind of snowballed from there. Got into the AMCA prep side of it as well. So built that course to deliver that bit of education, and it's just continued to grow. So I'm super, super happy. Now we have a staff of, as you can see, we have a staff of 5 people, well, 4.5, as Joel is a volunteer educator with us because he just loves to do it. And he's just a phenomenal guy. You'll get to hear him talk really soon. So yeah, that's me in a nutshell. I just have a passion for education, and I just want to kind of continue to pass that on. And any other things that kind of come up, I love to get involved with. So that's pretty much me. And I'm going to pass it along to Joel. He can give you a little brief who he is, why he's here, and then we'll talk about the other ones who can't quite make it today.
Thanks, Kyle. So thank you for the lovely introduction, Kyle. It's humbling to have that feedback from you, so I appreciate it, man. So my name is Joel. I'm a PCP in Ontario. I have my flight paramedic rating as well. Currently, I'm employed with the Canadian Forces. I'm based here in Ontario. So my job is a little bit different from what you may expect as a paramedic, certainly as you've been trained. I work with our military population, which for the most part is young, fit, motivated. So the types of injuries I'm exposed to on a regular basis are a little bit different from what we may see on the road. So conditions, endocrine emergencies, things like that may not necessarily apply in our population, but there's a bit of a caveat to that, which I'll talk about. So my role right now is I work in a primary care clinic. So it's as you would expect, as you'd find in any other kind of walk-in clinic in Ontario, except the focus is entirely on the military population, and sometimes with civilians in the case of foreign service. So a member from a allied military that is employed on our base will provide care to that member as well as to their family. So this can include the pediatric population. It can also include just different dynamics, and we can have health conditions that would otherwise preclude someone from service within the military. So Monday to Friday, my job is in that primary care role. It's more detailed assessments. It's involvement with X-ray, involvement with our laboratory, and things like that. We are, when I'm employed in the field, my job is working more austere, working more remote. And instead of having assets like an ambulance and a hospital to take someone to, I may have literally my backpack and the contents of my backpack and have to get kind of creative in terms of evacuation chains, setting up higher level care, getting really good with kind of just remote medicine, because like I said, it may be myself, I may be one of one, and then I'll be on the phone or some other communications means with whether it's a physician's assistant, nurse practitioner, doctor, surgeon, to say, here's what I have, here's the equipment I have available to me, and here's what my plan is. And then we can work collaboratively that way, which brings its own unique challenges as well for anybody who's ever tried to do any sort of detailed handover on the radio. So really, really interesting, long days. I am, because of my service with the military, I do volunteer because I'm not permitted to have another job, at least not in a conventional sense. But I work with Kyle because I am very, very passionate about what PCPs can bring to the table, but also through my military background, part of what we do is a lot of teaching. So I'm responsible for mentoring junior medics as they come in, junior soldiers as they come in, and kind of building them up and leading them. So from that, I found some pretty creative ways to help make concepts understandable for people. I'm would pride myself on being very, very good at planning a lecture, delivering lectures, and also identifying areas for improvement and helping people to achieve results that way. So I do a lot of tutoring sessions for Kyle. I like to work one-on-one, usually over telecon like we are now, to help people understand concepts that they're struggling with. In person, when we do workshops, it's a little bit more interactive. I'm a very animated person by nature, and so I try to bring my experience there. One of my downfalls, which may be of benefit to you, is when I do have experience, I like to pass it on. So we'll talk about a topic as it applies to PCP, but then I'll give kind of left and right, left being background physiology, anatomy, and then the right of it being next steps, which may not apply at our level, but in my opinion, and based off of what I do for a living, it's very, very good knowledge to have on deck. So that's kind of what I like to do. And I like to ultimately, if my whole philosophy is, if I were in the back of an ambulance, if it was my mother, father, brother, sister on that cot, who do I want them looking up at? And if it's somebody like myself, if it's somebody skilled like myself, like Kyle, that's a win. And so when we educate paramedics, I do want to have that mindset, and my contribution here then is to try to build that skill level with everybody so that ultimately our patients are getting the best care that they can. So thank you, Kyle, for having me on board, and thank you all for allowing me to sit down on the session with you.
Awesome. And kind of what Joel said at the end there is something that I really, really pride myself and all of the educators that we have here on is you kind of notice that this is scheduled 4 to 7, but the last topic there is 7 to a question mark, because we really don't like to put end times on these types of sessions, on these kinds of interactions, because questions can continue. And I don't want to make, I don't want anyone, whether it be kind of a paid client or you guys in this general information session, to feel that they have to walk away not getting something answered just because we ran out of time or just because someone else was talking a little bit too much. We want to make sure that we're giving our all the time. So our sessions consistently run longer than they should, and Joel can speak to that for sure. But we do it because we enjoy it. We do it because we like it. And there's honestly nothing more rewarding than getting that email or that Facebook message saying, hey man, I just got hired. Like, I've been trying for 2 years. Thank you guys so much. Or I just got my AMCA certification after my second attempt, or whatever it is. It's extremely rewarding for us. So this is why we really, really do enjoy it. Someone who can't be here, so
as well.
Yeah, please.
Sorry. If you do choose to use our online tutoring services, whether it's myself, whether it's Kyle, if we have a 1 hour session, as long as we're on topic and we're just kind of filling in questions and beyond what the content is, I'm okay if we go over, 15, even 20 minutes, that's fine. We're not going to, at least because ultimately Kyle will say this person has X number of hours. If we had a 1 hour session scheduled and we went a little bit over, I just return to Kyle and say, yeah, we only used an hour. It's not to the minute. It's not to, the nearest 15 minutes or whatever.
Yeah.
Because ultimately, I mean, if you have a
Deliver.
thought, I don't want somebody being afraid to ask questions because they're worried that,
Mhm.
oh my God, I'm going to get billed for this or whatever.
Yeah.
It's not how it works.
So it's about delivering content. So you guys will notice throughout this entire session that we're really strong on delivering positive content. There's other organizations and other people you can work with. And a lot of you guys are either in school or recently graduated schools. A lot of the educators across Ontario are just phenomenal people with tons of great experience. So your educators and your preceptors have already given you just invaluable information, or if you're just getting into your second year, they're going to give you invaluable information. So take everything that they say and just soak it in. We just wanted to provide you all the information about the additional resource that we can offer as well. So someone that can't be here is Thomas. Speaking of a phenomenal additional resource, Thomas is great. He's currently a PCP just recently hired on with Perth County. As you can see, he's previously worked in Peel, Toronto, and York. So 3 of the prime services that are, number 1, quite competitive, but number 2, high workload. So he's just experienced so many things over his career already. He's worked in the community paramedic aspect of it and building and kind of perfecting the community care paramedic delivery. So he's someone that we think is an absolute asset to our team, and we're really happy to have him on board. And then we have Max. Max is a new hire just recently this year with Hamilton EMS, and he's already just crushing it down in Hamilton. Realistically, he sends some messages of some of the calls that he's experienced and how things have gone. And in our skills and scenarios Facebook group, we have a private group that every week or so, sometimes we fall behind. So I apologize if you're on there and you're wondering when the next one's going to come up. But every week or so, we put up a scenario as well as some questions just to kind of facilitate a discussion. So if you aren't in that, jump in that. Free to join, of course, just all about sharing ideas and good content and trying to keep everyone engaged. And now that we have the new ALS 4.9, there's new things and new changes that everyone has to be aware about. In about an hour or in a bit, when we're at the halfway point, switching over to interviews, you're going to meet Leslie as well. Sorry guys, just skipping ahead here a couple. I just got to go back. Just making sure I'm getting everyone admitted that wants to be admitted. But yeah, so you're going to meet Leslie. She's going to go through a great presentation. She's been teaching paramedics for almost 20 years, I believe is the number realistically, and has been doing interview preparation, resume building, for a very, very long time. She's built great relationships with a lot of the hiring individuals throughout the GTA in Southern Ontario. So she really knows what the services are looking for. She's able to have the conversations and break down kind of the barriers of, hey, what are you looking for? How can we really make sure that we're educating our future paramedics to be what these services are looking for? So that's a really, really positive thing and a lot of great information to have. Okay, so does anyone have any quick questions before we get started, either on the layout or any questions about what we've talked about so far? No. Okay, great. So we're going to get started with scenario number 1. If anyone is willing to volunteer for this first one, just throw on your video or your mic and just kind of speak up and say you're ready to get started. It's a good one. Okay, so we'll wait a few more seconds for someone to jump in and be that first guinea pig.
Don't be shy.
This is exactly what you're going to be experiencing as you are going through your processes, right? So
here's the thing too.
Get it off your plate now. Now's a good chance.
Sure, I'll be the first.
Yes.
Okie dokie. We've got an I'll be the first. Can I just get your first name?
Jessica.
Hey, Jessica. Thank you so much for stepping up. What we're going to do, you are going to get some information about a scenario. We'll kind of leave it on the screen. I'll read it to you just so you can kind of hear the information and then take the next steps as you should, okay?
All right, sounds good.
Awesome. So you are called code 4 CTAS 2 for a 30-year-old patient complaining of dizziness, diarrhea, and abdo pain. So you're about 5 minutes away. You find a 30-year-old female patient unconscious on a couch with a friend present. Upon arrival, your first assessment shows you no obvious traumas. Carotid pulse is regular right now, okay? It is a little bit weak. You have a GCS of 3. The skin feels hot to the touch with a clear airway, and the patient's respirations are currently regular and deep. So the first things that you decide to do is have a small discussion with your bystander, right? You might be sending your partner in to do a little bit of future assessment, and then you're going to get some background information. So your patient's been complaining of abdominal discomfort for about 6 hours or so and was talking coherently until about 10 minutes ago. So with that rapid change in mentation, 911 was called. The friend doesn't live there, but came over because the patient said she wasn't really feeling too well, and the friend has not seen this happen before. So not too aware of medical history, okay? And the friend is very, very involved, so is currently actually going through for medicine and provides you this really valuable information that the vomit is clear, there's no blood in the stool, and there's no description for the abdominal pain since the patient's unconscious and can't really give you much. So where would you like to dive in with this call? What are your kind of next steps on scene?
Well, I'd like to get the cardiac monitor hooked up to her.
Great.
Take a blood sugar and ask. I'd just like to do that first.
Yeah, okay, sounds good. So you'll get the cardiac monitor hooked up. Okay, so you're going to start working on some vitals. And as those are in process, your partner's going to be working on those for you. So you can jump in and do anything that you were about to kind of talk about. So those are en route for you, and they're going to be back to you probably within a minute or so it takes for those things to come back.
Yeah. Okay. So she just said that she's been feeling sick for the last 6 hours, and
yeah.
Now it's okay.
Yep.
Sorry, I just want.
So that's okay. Yeah. So she's progressed pretty rapidly. She's been feeling really unwell, dizzy, abdo pain, nausea, and then over the last 10 minutes, her mentation has really gone down.
Okay. Has she been complaining of any other symptoms, headache, or not headache? You said dizziness, diarrhea, doesn't?
Yeah, exactly. So just kind of some generalized symptoms, but we've got a few things are going on here throughout her body.
Was she did she point to where her abdo pain was at all, or was it just?
So her friend said when she got there, the friend was kind of saying my stomach hurts so much, and now that she's unconscious, she's unable to really locate or direct you to exact locations.
Okay. Could I get a temperature as well?
Yeah, her temperature is hot to the touch, so she's about 38. They're just over 38.
Okay. Sorry, it's been a very long time since I've done scenarios.
Yeah, that's okay. And that's why we're doing this, right? Realistically, just feel free, just keep on rolling with it the best that you can. And if you get stuck, just kind of say, what would you do next? Or what, just whatever you think.
Okay.
Remember, you can always fall back on a few key questions, right? Whenever you're starting to think through, and this goes for any scenario, think sample, right? Number one, that's going to give you an idea of all of their existing past information, and then it lets you kind of formulate maybe your next steps, right? So number one, it kills a little bit of time if you're struggling and kind of treading some water, and it's also going to throw a lot of great information at you, right?
Mm.
So we're going to have you ask a sample now.
All right. So yeah, so she has no known allergies, it says here.
No, exactly.
Yeah, so she's on hydrocortisone.
Yeah,
So
so the friend actually just gives you this kind of little bag of medications. She's not really sure what it is or what it's for, but gives you this little baggie.
man. Okay. Yeah, so we would definitely want to administer that hydrocortisone.
Okay.
Given her presentation, she definitely meets criteria. I'm assuming she has Addison's right now. So
Yeah.
um,
Okay. Good. And so how are we going to go about that? What's our dosing plan, and how do we give it, and that kind of thing?
Isn't it 2 milligrams per kilogram at a
Yeah.
max dose of 100 milligrams?
Yeah,
Okay. And
exactly.
okay, so I'd give her the full 100 because her weight meets requirements. So
Yeah,
yeah,
it does.
that.
Exactly. So this is definitely our treatment plan as far as administration and medications. With the GCS of 3, we just want to make sure that we're checking on the airway, maintaining airway, right? See if she can control her own. We did in the previous slide show that we had respirations that are regular and deep. We didn't indicate any airway problems, but when you're going through this type of scenario, just make sure that you're showing them that you're aware, hey, we want to keep an eye on airway. We want to keep an eye on our basic ABCs, and ensure that throughout the entire call, we have each of those. Because in this type of situation, especially with an adrenal crisis, things can deteriorate very, very rapidly. Okay, so you hit the nail on the head with that treatment plan. So you're going to give a max dose of hydrocortisone. You're going to give it IM. So after that, we're going to start moving exactly en route, right? We're going to move to the ambulance. You've got your reassessed vital signs are actually there presently. Okay.
Okay.
So that's a really good thing as well. So we're starting to see a change and an improvement. We obviously, which one of these vitals seems really out of place? Which one of these vitals is a problem here?
Give me a sec.
Yep, take your time.
Blood pressure is really low.
Yeah, we've got a really low blood pressure here, right? So if you're in an IV certified service, they may be looking for you to work on that treatment option. Okay.
Yeah.
So just kind of keep that in mind. That usually does come hand in hand with the adrenal side. And they originally found the blood glucose level of 2.7. So she does fit for an administration of glucagon as well.
Okay.
Okay, so yeah, that was honestly good, right? So jumping in is the biggest thing, and then you immediately recognized what's likely going on due to the history and the medication, right? So that's huge that you're able to kind of make that identification, and then you were able to kind of pull the appropriate dosing out right away, right? So those are the things that they're going to be looking for. A lot of the services are doing a global rating scale assessment anyways, or something along the lines of a global rating scale. So we wanted to provide you a lot of information with this one, right? So like before you even really started, we gave you information from the friend, but in your actual interaction, they may be looking to you to poke at some of those questions as well, right? So we kind of just wanted to provide some good questioning. When you're doing yours, that might be part of what they're looking for as well, right, Jess?
Right. Yeah.
Awesome.
So it's important to know too, Kyle, it's important to know too, as you're going through for these, they very well may give you a medical scenario like this. But as Kyle's explaining, it may not have the information available, and they want to see if you can pull it. Everything after that, such as the actual medical information, dosing, route, medical considerations, that may actually be irrelevant to what they're evaluating. They may be looking purely for those soft skills. How would you talk to the bystander? what what kind of information are you looking for, just kind of finding out where your thinking is headed. So keep that in mind as well. And also, I mentioned this for a couple reasons. One, so you're aware of it, but two, don't get rattled, because if you don't know doses verbatim in the real world, not like in school, in the real world, we all have our books, or we have some kind of reference available. And best practice is that you're going to pull your book out and you're going to check before you give a drug that you can't take back. So understanding that, hiring scenarios work very, very differently from what we're used to seeing at the college level.
Mhm.
Yeah. So just be aware of that, especially if you were someone who may have graduated that maybe 2 years ago or so. In that, there's even been a major change in the thought processes of hiring to this point, right? With the kind of global adaptation of the GRS, and not the kind of memorize verbatim the sheet and then spit all the points out and oxygen in 2 minutes and everything as the BLS changed, right? So there's a lot of things that have changed over this last little bit. So soft skills are extremely important as well, like Joel was just getting at. So the next scenario, we'll have Joel go through. We're going to try and get through the meat and potatoes pretty quickly, and then get into the treatment plan. So there's a lot of information here, but we're going to kind of bang through it. Does anyone want to jump in for this next one? Thanks so much, Jess, for kind of being that first volunteer, and you did a great job.
Thank
Awesome.
you.
Just while we're waiting on the next volunteer, if anybody has questions in the chat, I'm keeping an eye on that as well. So by all means,
Sure.
fire away. If you don't want to be that person who puts their mic on, or whatever the case is.
Cool. Okay, who's up? We're going to jump into scenario 2.
Bueller.
Okay, so we'll pick someone in about 6 seconds.
Ooh.
And I've only got like 5 names in front of me because of the way that my screen's set up. So
I can get more. Do you want more?
yeah. Okay, we're obviously not going to make anyone uncomfortable. So if I say your name and you really don't want to do it, you're not going to be forced into anything. This is, again, just supposed to be experience and fun and interactive. Maddie, I'm not sure who Maddie is. Maddie, are you comfortable trying to jump into a scenario?
Yeah, I can try. I'm just first year, so something.
No worries.
Okay, Joel, what was your scenario, just thinking in your own head? Because just for a first year, realistically, there might not be.
This one, it may be tough. This is the kind of thing that you may see a bit more with experience. If you want to try, by all means. Like I am a big fan of hitting above your weight. So
all right.
If you're comfortable trying it, that's great. If there's a second year who kind of wants to do it to get the practice in of what they might see on their actual hiring stuff, because this is pretty current with what's going on right now, then we'll open the floor just for another 10 seconds. But if not, then Maddie, we're happy to have you.
Sounds good.
Okie dokie. So all of you guys who are here, just kind of play along at home, obviously, as you have been. Really try and use this time and this information to, what would I do next? Don't just wait for the answer and be like, oh, okay, yeah, that makes sense. Kind of try and think in that, if you were in the hot seat, right? What questions would you ask? How are you going to assess this patient? Physical assessment wise, what are you looking for? Okay, so Joel, you can go ahead here.
okay, so it's round 2. At about 0930 one morning, you're called CTAS 3 to a residence for a 61-year-old male behaving abnormally. On arrival, you're greeted by Jenny, who identifies herself as the patient's daughter. Jenny states that dad's not himself. We woke up today for breakfast and he's not making any sense and doesn't want to get out of bed. He's having a hard time walking. Jenny leads you to a well-kept home, leads you through a well-kept home to her father's bedroom, where you find Maurice lying in bed and working on a Sudoku puzzle on his tablet computer, trying to fill in the puzzle with a pencil. Maurice doesn't pay much attention to you as you introduce yourself and your partner. Your partner applies EKG, SpO2, and begins to take a blood pressure while you speak with Jenny. You determine that Maurice recently had a partial knee replacement surgery because he's been non-compliant, but he has been non-compliant with his antibiotics and, quote, only takes his pain meds when he needs them. She further explains that, quote, he was great with his last knee replacement, but he's getting older now, and I think he's stubborn. He's retired from the RCMP, and he acts like he still thinks he's 25. So without, too late. Okay, so on physical assessment, sorry. So without moving too far into the scenario as yet, let's go just kind of scatter start. Where does your mind go when you're looking at a patient like this?
Yeah, what are
Um,
some of your,
Sorry, go ahead.
I was just gonna say, what are some of your kind of buzzwords and your key thoughts? This is great.
Worried
Even about the
about
scenario, what stands out to you from what
the
you see on your screen?
puzzle and pencil for sure.
Right.
That's concerning. It's not, especially if it's not usual for him, which his daughter pointed out, he's not acting the way he normally does. He's struggling to walk, which can be normal for him because he just had the surgery, but I'd want to examine the surgery site and anything in general just to see if there's another cause for that issue
Good.
with walking.
Mhm.
I'd probably just go through ABCs as well to see if
Okay.
anything stands out there.
Okay.
Um,
And then
and
without talking about kind of next steps, based off of what you can already see, what are some differentials? What are some things that come to mind for, okay, what can explain his altered LOA or his altered presentation?
it could be, I think of like AEIO tips, like
Okay,
the,
good.
so it could be some kind of substance use. It says he's not compliant with his antibiotics, doesn't always take his pain meds, but maybe he's taking something else or drinking, anything like that. Could be diabetic,
Good.
Mhm.
stuff like that.
Good. Good start. Good start.
Great. Are you ready to go forward, Joel?
Yes, please.
Awesome.
Okay, so on a physical assessment, you notice that Maurice is wearing a pair of short running shorts and nothing else. He's a fit male, good muscular tone for his age, and well-developed quadriceps. There are about 25 staples placed at the incision site, anterior medial aspect of his right knee. There is a gray to yellow exudate between most staples, Callar, Doller, and Rober to the area, and erythema to approximately the mid-thigh medial aspect. On palpation, you notice fluctuation. Nothing remarkable to the contralateral or elsewhere on his body. Your partner returns with the following vitals that you can see on your screen. So now, first, with what's on your screen for your latest development, after you kind of take a look over, what would you be leaning towards?
Infection.
Infection. Okay.
Yeah.
Okay. And then for Callar, Doller, and Ruber, do you understand? Like, do you understand what that refers to?
No, I don't know those words.
Okay. So Callar is localized heat.
Okay.
Doller is pain with palpation, and then
Mhm.
Ruber is redness. So we would very well say localized heat, tender to palpation, and erythema. Erythema more, it's not necessarily accurate in this case. Ruber would be the terminology, especially if you're looking to do documentation. It just makes it shorter.
Mhm.
Okay.
Fluctuation. Are you familiar with that term?
Yeah.
Okay, great.
So
So
they
for
do
anybody who's
fluctuate.
not, when we're assessing wounds, if you press on it and it feels almost like a water bed, or if I press down here and it pops up over here, that's fluctuation, and that's a sign that there's a lot of fluid accumulating. A fluid, whether it be drainage that can't drain, whether it be whether it be any kind of abscess developing or products of that infection. So good, very very good. So with this patient, then you're leaning towards infection, and that's good. What are some things you'd like to know, and then what are your next steps for managing Maurice?
If his daughter has any idea when he last took his antibiotics, or she has the pill bottle with her, the prescription, a
Okay.
temperature would be good.
Okay, good.
I'm not sure what else I would want to know.
Okay. On the right track for sure. Is there anybody else that, even in the chat, if there's some other things you'd like to know before we move on? But you're doing great. If you're ready to, we can move to the next slide.
Okay, here we go.
Okay. So as you get sample history, signs and symptoms, altered LOA, and he has abnormal behavior. I mean, he's trying to fill a tablet in with a pencil, which I
Yeah.
think we can all agree. He's 61. He's not elderly by any means. He's probably familiar, especially if he's a retired RCMP officer. He's probably familiar with the concept of a computer. For our geriatric population, that may not be the case, but for him, that's higher up on my index of suspicion.
And it's not an Apple Pencil, it's a real pencil.
Yeah, it's a graphite HB #2 that you will use for the MCA.
Yes.
Allergies. He's allergic to erythromycin, but he doesn't have a specified reaction. His daughter doesn't know why he can't use it.
Okay.
For medications, he does take Tramadol. It's prescribed PRN for his breakthrough pain. He's on Eliquis, 2.5 milligrams PO twice a day, ibuprofen 600 milligrams twice a day, and amoxiclav 850 milligrams 4 times a day. Past medical history, he had a right knee replacement approximately 5 days ago. His left knee was replaced. It was a partial replacement in 2010. He has many MSK issues from sports and certainly from his job, and a history of hyperlipidemia. His last oral intake then, they had dinner last night. They had takeout fajitas with salad and churros at about 6 at night. Events prior, he was doing his physiotherapy exercises, but he cut short because he said he was in a lot of pain.
Okay, so what is your thought process on how we might be treating this patient just before we go ahead and show you? Like what would you want to do? And Joel, there's a couple updates in the chat. I'm just not sure if you
Yeah, so people were they were wondering what his BP was. His BP was 105 on 74.
Great. So treatment plan and then disposition. So disposition being how would you depart on what level of acuity and that kind of thing. I know you might not have gone super deep into that, so that's okay, being at your stage, but just what you think you would want to do.
Checking out the chat.
Work smart, not hard, Maddie. You're crushing it.
I'm assuming is amoxiclav the antibiotic?
It is, yes.
Yeah. And it's not related to erythromycin at all?
No.
Okay. I guess if I was IV certified, it wouldn't hurt to start an IV maybe?
Yes.
Start an IV, yes. And because of the blood pressure, are you able to administer fluid, or do you have to ask someone to administer some fluid?
Would not know.
So because of how that is, since the blood pressure is not currently hypotensive, you would just have to do a quick little patch to the base hospital. This would be a slam dunk case if you keep the history and the vitals, and then just say, I want to do a little bit of a fluid challenge. They're going to grant it to you 10 times out of 10. It's just the way that the directive is written itself. But yeah, you're absolutely right. Fluid is going to be huge for this patient. We need, even though we might have, with that fluctuation, we obviously have some bad fluid trapped. We need systemic fluid, right? We need fluid in the vascularity. That's what's going to be really helping in this situation. So you're absolutely right with fluid, supportive care, and kind of moving in the right direction. So disposition, what are you thinking in terms of transport? I'm not sure where you go to school. So if you do CTAS or codes or whatever, you probably do both, but like what priority would you want to return on? And do you fit any bypasses or anything like that?
Yes, confused with that. Code 4, and then either CTEST 2 or 3. He's not like immediate risk. Like he seems pretty stable.
Okay.
So I don't think it would warrant a patch, but could be wrong there.
Okay. Does anybody else have any thoughts on this? Like in the chat, or either you can throw your mic on as well. How you would transport this patient, like disposition wise, possibly patch versus no patch, or why you might do that, because this patient doesn't quite fit for the sepsis alert in Canada, or in Ontario, excuse me. Well, they have a little bit of each of those kind of boxes, but with the blood pressure and everything, we're not quite hitting any of the vitals that require for the sepsis alert, as far as I can kind of pull out of it. It looks like we're borderline though, so we're looking at SIRS, right? The SIRS, which is kind of the step right before, as we're getting into sepsis for just pre-septic shock. So this is something that for me, I would definitely look to treat with the IV therapy and then depart on likely a pair of 3s, realistically, because of how they're presenting, like a 3-3, but I would patch this. Depending on how far you are and depending on local policies too, you might end up going on a priority 2, depends on the altered. So the altered LOA, depending on how confused that person is, that may give you that push into a priority 2 or a CTAS 2. So it might even be 3-2, right? Like a code 3, so not lights, but still a CTAS 2 because of the altered LOA, right? Does anyone else have any comments? Looks like there's a couple more jumping in the chat there, Joel. Anybody have any other views, ideas, or thoughts?
So somebody's saying only 2 on the sepsis pre-alert. I'm thinking just infection. Pair of 3s maybe to transport. So
Yeah.
again, we explored that pretty thoroughly. One thing I do want to point out, and I certainly I don't mean to rip apart your phrasing, but this is the kind of thing that will be very important during interviews. It is very, very important to be precise in what you mean. So infections do kill people, quite frankly. There's no such thing, at least in my opinion, in my clinical experience, there's no such thing as just an infection, because if not treated aggressively, certainly at the hospital level, this is the kind of thing that can quickly get out of control, and it can be very, very complicated very, very quickly, even in an otherwise young, healthy person. And I mean, he's 61, but he's obviously fit by the description in the scenario. So he is an otherwise healthy person, but they can decline very, very quickly. The key is that when we get to the hospital, it is our quite frankly, I don't say this lightly, it is our duty to be that patient's advocate. And so if we present to the triage nurse and we're not, if we say, yeah, I think he's just got an infection, that's not really building a strong case for this person to have that care. And oh my God, what kind of an infection? So if we say, I believe that he's pre-sepsis, he has an infection, that qualifier of just can change the entire dynamic of how this call goes and how that patient's received at the ER. So again, and I don't mean to put you on the spot in any way. I just want to take the point to indicate that we do have to, especially for hiring, be very, very clear with what we mean to say.
And it's also huge that when you do present that patient to the triage nurse, as soon as you say sepsis or pre-sepsis, it actually qualifies them their requirement to go through their sepsis protocol. So to do a full set of blood work and then do the sepsis panel to make sure that immediately the initial set of vitals does include that full CBC and sepsis panel to get all that information back and start the treatment as early as possible. So this person may be on offload for a bit, but that doesn't mean that they aren't starting with the blood work and determining the appropriate treatment plan.
Because the other side of that is that, yeah, I mean, for a sepsis panel, it takes a little while with the big tubes that they collect. It takes a little bit to culture that. So they very well may be on offload, but it's the time to get that started. If you've ever heard the phrase door to needle, certainly we're talking about that surgically, and we're talking about that in terms of cath lab, but with lab work proper, that is critical as well, or it can be critical.
Absolutely. Great. Yeah, so as you see, after the appropriate treatment there, we get the fluid in after our base hospital authorization to do so. Get that fluid in, blood pressure's coming up. Still confused because we're not going to be able to change altered with a little bit of fluid, but at least we're kind of moving in the right direction to kind of get that stability in order for the hospital to be able to treat appropriately.
Yeah.
So that was a really good job, Maddie.
Somebody had another question. They said, with the new hypoglycemia directive, would we take a blood glucose for this patient since we don't suspect hypo? So the new directive, it basically says if you have cause to believe that this can be of benefit to you, or this is good information to know, there's not really any harm in doing so. With that being said, I wouldn't necessarily include it routinely for vitals, but in a patient like this, where they're a little bit obtunded, or a lot bit obtunded, and they're not responding as you would expect, it's not unreasonable to want to know what their blood glucometry is. So
also, something that's huge that some of the schools are pushing on and other ones not as much is that you'll actually start to notice that with an infection or more severe infection, you're going to have an increase in blood glucose. So it's also a really good vital to have to provide the hospital, because it can also show them the progression of the infection possibly. Like there is a really strong correlation with higher blood sugar levels and sepsis. So they're working on things right now where any blood sugar greater than 10 for a non-diabetic or a non-medical kind of nobody with a sugar history is an indicator of that higher risk of sepsis. Okay. Anybody have any questions about that one?
And so this one, I had written this scenario. This scenario it's more of a direct kind of cause and effect. He had surgery, the site is infected, he's not compliant with medication. I was part of the team that responded to the long-term care facilities, and infections are, unfortunately, they are common in healthcare environments, whether that be a hospital or, in the case that I was in, it was a nursing home. Infections don't have to be as clear cut. There was surgery, there was an incision, I see exudate. It could be from any number of means. So here again, for illustration purposes, I chose to go with a very clear cut, if you forgive the pun, a very clear cut infection. But if you don't take it off of your differential, especially considering certain environments that you may respond to on the road or that you may be presented in a scenario for hiring.
Mm-hmm. Definitely. Okay, great. Any questions at all from that one, Maddie, about how it went for you, or any questions about what information was provided or any of the background stuff, or all set?
I don't think so. You guys explained that well. It's just like
Awesome.
a learning curve.
That's exactly it. And if honestly, kudos to you for jumping in on this presentation being in first year, because it's going to give you a bunch of information to be that jump off, and then you have all of the year ahead of you to kind of soak in the information from your preceptors, your instructors, and just kind of build your knowledge base. So that's a really, really good start. Awesome.
Yeah. On the other side of it too is it's interesting because you get a lot of scenarios where, and especially for hiring, you don't always have to give a drug. You don't always have to initiate a treatment, but you do have to have a concept of what's happening with your patient. And they may even prompt you to, what do you think will happen to this patient in hospital or at higher levels of care, just so you have an understanding of what's going on.
For example, a few years ago, the hiring interview or the hiring scenario for Niagara was actually a sign-off. It was appropriately getting to a sign-off. So there again, it depends on the service. It depends on if maybe over the year they had a couple cases that went through QA that were a little bit odd. They want to see how new people, new medics coming through might be handling those situations, right? So there's just such a vast possibility of everything from kind of soft skills to treatment to everything like that. Okay. Awesome. Okay. So everyone can see that again. For some reason, my display just decided to switch up on me. Is everyone able to see this presentation or the scenario?
No.
No. Okay. There we go. That's why. Okay, here we go. Now everybody can see it. Okay, scenario 3. Who wants to jump in here? Who's going to be our person? Let's get one of our second-year students that are going through the hiring process. Who's doing it?
I'll give it a try. I literally just learned cardiac arrest last week.
Good. That's exciting.
Only for cardiac arrest. I don't know anything trauma-based yet.
Okay, that sounds good. So you're in second year then?
I go to Oxford, so it's
Third term.
Yeah, I'm third term.
Yeah. Okay. Yeah. Awesome. Great. So yeah. So with this scenario, you are called code 4C test 1 to a 45-year-old male with reports of cardiac arrest. You arrive on scene to see a police officer performing chest compressions on the male lying supine on the ground. What are your first steps of interaction here? Like you do your window assessment, right? So you look for scene safety, all this stuff, you put your PPE on, you jump out. What are you going to be doing? Walk me through.
Is there any other allies on scene or a bystander so I can ask what's going on? Or
Nope, you just have the police officer who came across this individual and immediately called it in. You hear fire ripping down the street with their air horn and siren. They should be about a minute or so away.
I'll ask the officer how long he's currently been performing chest compressions. I'll get my monitor set up right away and my probably get my pads on.
Great. Okay, so the officer says he's been there for about 2 minutes or so. He immediately kind of called it in when he saw the male lying on the ground, motionless. He was unable to feel any kind of pulses in the carotid, so he just started CPR immediately. So you put your pads and monitor on while you do your initial assessment.
Okay.
So what's in your initial assessment? What are your first steps on scene with an unconscious or cardiac arrest male?
Like if I walked in, it was like my scenario. I walked in, had my partner. I would have done my first analyze. I go to check for a heartbeat. If there was no heartbeat, I'd set up.
Good.
I don't know ECGs yet. We just learned.
That's okay.
Liver VTAC.
Yeah,
So-
that's okay. But you're even ahead of the game on that, right? CAB, first steps on scene. You need to check a carotid pulse, right?
Yep.
Check for
Okay.
cardiac output, look for an airway, initiate breathing. So CAB, your first steps, even before you're worrying about what analyzing you're going to be doing. Yes, immediate shock and compressions are important, but CAB to just get your baseline assessment done.
Okay. So
Okay.
do that, and then I'm not going to take over compressions because I'm going to have to manage the patient myself. And as soon as
Yep.
fire, I'll have fire switch out with police or anyone who could or may not be
Great.
certified.
Yeah. Yep.
Yeah, my monitor will be up. I'll get a heart rate, respiratory rate, blood pressure, SpO2 reading, and an end tidal.
Good. So with your CAB, you find a patient who does have a carotid pulse. On further assessment, you see someone who is breathing spontaneously, slowly, with snoring respirations audible. Okay.
Okay. I'll go to the
And you-
area, do a head tilt chin lift, see
Okay.
if that helps. If not,
im-
I can't say maybe potentially an OPA if he will
Okay.
accept it, if he's conscious.
Great. Yeah, so he is quite unconscious. You're able to slide an OPA in well because your head tilt chin lift didn't quite get it. Also, great job. One of the things that a lot of the services are looking for is moving through the BLS steps before medical device insertions. So all of you guys absolutely try to do your maneuvers before you go, okay, I'm going to put a King LT in, or okay, I'm going to do this LMA or whatever. Try your maneuvers and manipulations before you move into a piece of equipment. Okay, so that was a really good job. You got your OPA in and you asked for all of these vitals. So you have these vitals as found in front of you. Your partner reports all of these to you.
Okay. So I have a partner, so maybe I'll get my partner to take over compressions at this time. Or no, I'll have my
yeah.
partner go on airway.
Beautiful. Great choice, because it's much more important for us to be the ones in charge of airway and appropriate oxygenation and just have someone, whoever has hands, to push on the chest, right? So that's a great call. Good choice.
And there's absolutely no one around that could tell me what happened before this happened. Like I can't ask any sample at all.
Realistically, what kind of questions would you want to ask in sample? So the officer knows the person. The officer knows who the person is. They've had quite a bit of interaction with that individual.
Okay. Potentially, what was the person doing before this, and how are they feeling?
So the officer says that they had an interaction with the person about 2 hours ago. It was at a party. And this person has consistently had interactions with police and paramedics with overdoses in the past due to some substance misuse. So they've administered Narcan in the past. The officer wasn't carrying the Narcan at this time, so he was not able to administer anything that he thought it might have been. But with that, he's kind of, again, had these multiple interactions with the person, doesn't think that they have any allergies at all, and said that what he saw was the part where the patient just found lying supine on the ground when he was around him about 2 hours ago, seeing him normal.
I had my partner start ventilating. His respiratory rate is O2 sat, so I'm gonna get them to hook up a BVM with an end tidal on it.
Great.
Pupils. Is there any like pills? Like, was there any pills or anything in the airway? Like, was the airway clear and patent?
The airway was not protected because of the snoring, but when you put the OPA in, you had a patent airway following that, and there was nothing obstructing. So like no pills, nothing in the airway, no blood, no anything like that.
There's no needles around, any drugs around the patient at all? Like, it's clear?
As you do go up and kind of get closer, beside him, you do see kind of a glass pipe and some tin foil and things like that, and a little baggie with an unknown white substance in it.
Okay, so that's when I would be suspecting a overdose. I could drop Narcan. I haven't learned Narcan yet, so I don't really
Okay.
know what I could potentially be giving, but obviously I would give it IM and a deltoid, right or left. I'm
Okay.
unsure the exact what's the
Dose?
the exact
Is that the
dose.
word you're looking for? Okay. Who can jump in the chat box with the dose? Anyone that's in your hiring processes right now with our new ALS 4.9 change?
0.4?
What is our, yes, exactly. Thank you very much. 0.4, because
If you're
we've
gonna put a
switched.
dose in, we just want to know what route as well that applies to.
Yeah, because yeah, awesome. Yeah, and then IV, anyone that is IV certified, that dose remained the same. And then IN actually changed. Does anyone know what IN changed up to?
Not sure.
So 2 to 4. Okay, so with the new ALS change, it changed to 2 to 4. But you stated that you wanted to do IM, so that's absolutely the preferred route if you don't have an IV initiated. Okay.
Right, and then so as soon as I give that, how is the patient reactive to the medication? I'd get a vital after.
Yeah, so you'd get a set of vitals afterwards, after you've done this action and intubation. And with this new ALS 4.9 change, this is what I want you to have a look at, just because this is our important information for this one, right?
Somebody asked the question, am I muted? No, I'm not. Somebody asked a question based on the companion document, should it be SC first? So now they're saying no. So what's important to note is in our directives, from left to right, that's the order of preference for how this drug should be administered. SC is now the least preferred route. The most preferred would be IV, but if you're not IV certified, PCP autonomous IV certified, then IM would be your next best.
Yeah, because with the IV, we have the ability to titrate, and titration is huge. We don't just want to slam them with a full dose of Narcan, because that person's going to just shoot up and be eyes open, screaming. You don't know what polypharmacy we have to be concerned about, right? Because a lot of times it's not strictly a morphine or a fentanyl that's being ingested. It's cut with something, right? So it might be an upper that it's cut with. So the fentanyl is causing this respiratory depression, but as soon as we are able to utilize the Narcan to kick that off the receptor, right, to be that antagonist, we are now exposing whatever other substance is working aggressively on the body. And if it's an amphetamine or some kind of high upper, you might get a very, very agitated individual, right? And now you've completely compromised scene safety for yourself, your patient, all of that. So that's actually why they moved the IV to the preferred route, because you can titrate just for respiratory drive, right? So you're only going to be looking to give just enough for where they're breathing on their own. So that's what you need to think about. So it's easy to just pump an IM, dump it in, put in that max dose, and then just wait for them to come around. And if you're PCP without an IV or not working with an ACP partner, then that's absolutely the correct and appropriate management. but it's just great that they've kind of moved the IV forward, because there is a lot of services that are moving to PCP IV. So it kind of gives that thought process of, you know what, take a couple extra minutes to get a good strong line, give the medication at an appropriate dose just for that respiratory drive.
And there's 2 points I want to touch on. So in the chat, there's doses given. So I want to clarify. Somebody gets 2 to 4 milligrams. Somebody gets 3 to 4 milligrams. Those higher doses apply to intranasal injections or administration correction. So when you are administering it by an atomizer device, it requires a little bit more, because some of it unfortunately gets wasted. It can run down into the nasopharynx and into the subsequent airway, or it can kind of get trapped. So we want to make sure that when we have that, that's why we have those larger doses. Similarly, depending on what atomizer device you'll use, there's a certain amount of dead space. So you have to compensate for that. So if I draw up 2 milligrams, I may only actually get 1, if that, administered according to what device I'm using. So keep this in mind as well. Lastly, for the intranasal route, the correct dosing would be 2 to 4 milligrams. And finally, into clinical considerations of this directive, it not the same wording that I had to know verbatim for college and then write it out blind on a sheet of paper, but the effect is, or the message is still there, that the goal of Narcan is not to restore full alertness. The goal of Narcan is just to provide respiratory support while we're moving our patient, or if the patient cannot be managed in another way. As Kyle said, and I won't beat a dead horse, we don't know necessarily what this person has on board, and they may be quite upset if we completely, for lack of a better term, kick the opioid out of their system. So for safety, certainly, but for patient comfort as well, because these patients could potentially hurt themselves. If they become violent and police are on scene, they may be subject to use of force, whether that be forcible restraint, whether that be tasing, whether that be some other means. So we don't want to set that up for our patient. We want to have an otherwise good outcome. And when they gradually have this cleared out of the system in hospital, hopefully we'll have addictions therapy and rehab available for them. Whatever, that's beyond our control, but that's the hope. So
and with these patients, obviously the way that this one is presented, it's pretty slam dunk to be thinking opioid overdose, Narcan, this is great. But you'll see the directive did get changed. The age group is greater than 24 hours old, right? So there's going to be times when there's the pediatrics that fit for this. So obviously looking at vital signs and LOCs, and not thinking, obviously there's a big difference. You're not likely to see a 3 or 4 year old getting into fentanyl in a corner of a parking lot. You're likely to see maybe a 3 or 4 year old getting into pills at mom and dad's house or at grandma's house or something like that. So be very aware of pharmacological calls and presentations, because it is just, again, it's a high risk. And there's 11 pills that can kill, right? So go through some of your pharmacology stuff and some of your toxicology. That's going to be huge, not only on your MCA and in your hiring, but actually in your practice.
So Kyle, I'm keeping an eye on the chat for you here, and there's a good dialogue going, and I really like to see this. So Samantha has a question saying, wondering the use of naloxone in this arrest, because a medical cardiac arrest says, and I would agree with this, so I want to know what your thoughts are. Medical cardiac arrest says there's no clear role for the administration of naloxone in cardiac arrest. Now,
is this a cardiac arrest? Is this a cardiac arrest? Has this ever been a cardiac arrest?
Let's I'll have to jump back into the scenario, but I think we determined that no, there was no need at this time.
There was never an arrest, right? It was called in as one by a quote, like a layperson. A police officer is a first responder and super valuable, but I wouldn't trust them to tell me if there's a pulse or not. Realistically, he's doing CPR because he didn't find one. When we got there, we immediately assessed. We did our CAB and we found a pulse. That's the first bit of information you get of your own assessment. So that immediately eliminates that. The point you made is fantastic. You're absolutely right. If we have a BSA, we're not just going to routinely give Narcan. You're 100% bang on. But this call, it really was never a cardiac arrest that we were working with. It was another thing that we want to ensure, even in scenario world, when you're doing your hiring stuff, is don't rely on the information from dispatch. because they work with the information they get and they pass it along like a little bit of broken telephone. They do their absolute best with so much information being thrown at them, and someone says cardiac arrest or he's not breathing, they have to assume worst case as well. So when they're issuing the call and choosing the appropriate card, it might come in as cardiac arrest. And that's why our job is to always assess, hands-on, physical, routine, CAB physical assessment, right? Gross hemorrhage, look for everything, do your absolute kind of quick and dirty assessment to see what you're working with, because it might not be the same details that you got.
Great. So then the next question then, I want to know what your take is on this. To me, I know what I would answer anyways. It says, with the pediatric and an overdose, would you still give the entire dose? To my mind, the answer then would be yes, because there's not really a case for overdose or over administration of naloxone in an overdose situation. What's your take on that, Al?
Yeah, it's not weight-based, right? It's not a weight-based medication. It's a medication there to ensure that there's an appropriate concentration of the drug to have its what's the word that I'm looking for? At the receptor. It's antagonistic. Its antagonistic effects actually work. So that's why, again, IV and IO. IO has been added for likely in the pediatric population. We can utilize IO in the if we're thinking pre-arrest due to this this overdose, right? If they're starting to get peripherally shut down. So IVIO for this titration is exactly what we would like to utilize for that pediatric patient. So we don't have to slam an entire dose in. We can, again, titrate to that respiratory drive is the preferred and hopeful route. But in the IM situation, if you do have to go that way, then the 0.4, it's kind of like the aspirin side, right? Where risk reward, the absolute high reward of the medication being administered is going to severely outweigh the risks. Like there's really no downside of Narcan, for example. So it's the protocol is written, it's not weight based. So don't feel like you have to do calculations for it. Just don't go over that 0.4 for anyone.
Good. So then with that in mind, something else I'd like to point out, I think our temperature for our casualties 35.4. It was in the 35s.
Yeah,
he's pretty cold.
That.
He's pretty cold. So I mean, certainly, I mean, I've been very cold before, certainly doing winter warfare kind of activities and whatnot, frozen to the ground, and I never want to discuss that again. So it's important to know that this altered LOA presentation, we're painting a picture for an opioid overdose, but he's very, very cold. He's probably cold to the touch. Certainly when somebody's at 36 degrees, even, 36 and a half or so, they may feel slightly cool to the touch. So now that he's in the 35s, he'll be very, very cold, and his metabolic processes will probably start slowing down. His thinking is probably going to be the first thing that slows down with that. So yes, we are painting the scene for a narcotics overdose, and it's great feedback and great line of thinking. But if they're giving you a vital, especially if a vital is to be outside of the normal range, that's probably significant, and you should probably pay attention to that and at least comment on it to show that, again, like we said, we're not always looking to give a drug. We very well may give Narcan and it will do nothing for this casualties presentation because he needs to get somewhere, he or she needs to get somewhere warm. In this case, it was a he. They need to get somewhere warm. They need to get, maybe it's a street person, maybe this is a person who this is a regular occurrence and they need some kind of community outreach. And the reason I keep harping on the community outreach, the social assistance, one, because I believe in it, but two, like I said, we're advocates for all of our patients. If somebody's in a substandard living condition, whatever that may look like, whether it's an elderly person and they're having difficulty taking care of their household now that they're getting on in years, certainly if it's a child in distress or a child in an unfit living environment, or if it's a street person, a lot of services would look favorably on the fact that you at least recognize that there are more people at play to ensure a patient's success than just myself, my partner, and my truck.
Yeah, and that's exactly it. We're going to discuss a little bit more in the interview portion about what kind of brand ambassadorship is and things like that, and being kind of a face for the region and who your employer is. But that's exactly right. Like our job is to ensure that every single person has access to healthcare, and healthcare doesn't just mean going to the emergency room. And it means being cared for and ensuring that your health is at an adequate level. and ensuring that they have ways to get to safe beds or out of the cold or anything that the region is setting up. In Niagara specifically, we actually have a few units that is actually their only job. They're in an SUV and they're in the community outreach and working with kind of the less fortunate, the homeless individuals, people who have addictions, things like that. But another thing I wanted to pull back on with kind of what Joel was saying is obviously some of the vitals that were given with the pupils of 1 millimeter. And when you asked if you found any substances, like, yep, you actually found some paraphernalia and some drug, that kind of slam dunks you to go down that route for Narcan. So for that suspected overdose. So you did a great job even with the wording of, okay, I'm suspecting overdose. That's huge. Like that, literally doing that wording is already going to get you in like some extra points with your marker, saying, great, they're really comfortable with it and the protocol itself. So with that though, it really changes the game if we don't give you that pupils, right? So if we don't present that, or if you ask and pupils are free and slow to react, that completely changes your thought process. So it could be that hypothermia patient, right? Especially with it being the winter. It could be a fall and head injury, right? So all of these things are on your differential diagnoses before you find that one thing that kind of puts you down your path, right? So just make sure that you don't get stuck in that path of, okay, well, because there's an opiate crisis, they're definitely going to ask me about an overdose. Like that's not even remotely true. And especially with these service hiring stuff, they want to see kind of a broad presentation of how you would react in some of those situations where it's not quite standard. In everything that I've heard back from former clients and kind of coworkers and colleagues, none of the services that they've ever applied to have tried to trick you. Okay, so be aware of that. And make sure that you're not going in thinking, oh man, they're just going to throw something random at me. I'm not going to be able to, like, I probably won't even get it, or that I might miss this little thing. They're very, very well written and well presented scenarios. So make sure that you just walk through it at a pace and a rate that you would actually do on scene. So while you're in your consolidation, see what your paramedic instructors are doing. See how we kind of carry ourselves and interact with the patients, because that's all they want you to do. They don't want you running around and kind of looking for buzzwords. They don't want you trying to find that one piece of information that's just going to unlock the whole scenario, right? They want you to just make your way through the interaction and see how you kind of get to the decisions that you're making, right? So again, the biggest thing, that they're not going to be trying to trick you. They're very straightforward. They may or may not use a protocol, as Joel has already kind of commented on. It could be something as simple as a hanging VSA, right? A hanging VSA. How are you going to manage it? How are you going to manage the scene? How are you maybe going to deliver a death notification? Or how are you going to call BHP for a termination of resuscitation? Like all these different things that play into that. It's not a super complex call. It's just how are you going to handle it and manage it, right? So that is the third scenario. So we only had 3 to go through and just wanted to get the conversation going. So based on the 3 scenarios so far, or any other topics, does anyone have any questions? We got a little bit of Q&A before we jump into the interview stuff. We'll do interview stuff in about 10 minutes. So
there's a question in the chat.
Awesome.
So Max saying, any tips with updating the pocket directives? Thinking of just printing out the new info and taking it in there. So that can definitely work. If you work for a service, or if you have a book from your service, oftentimes, at least on preceptorship, what they did was they would print out an actual sticker and it said, okay, this supersedes whatever's in your book. Go ahead and put it on there. You can definitely print it out. If it's already bound, it's a little bit harder to replace. But if it's not bound, you can definitely print out the page. Depending on what school you go to, the print shop may actually have pretty affordable printing, depending on what your circumstances are, depending on what your budget is, right? So they could potentially just print you a new book. You can get it on, splash resistant paper and things like that.
And utilize the OBHG app, guys. They worked a lot on the app to launch it a few years ago. It has its own problems right now that they're currently working on, and should be launching one really, really soon with kind of a full overhaul. But that OBHG app is extremely useful. Some of the complaints on it are when I click on the protocols to get in, it does this update, right? It does the update, and you don't want to be clicking on it when you need to confirm a directive and get this like loading screen, because it's super annoying. a quick little fix for that, if you just throw on your airplane mode right before you try and go into it, it stops any of the push updates or push downloads. So airplane mode and then open it, and then you can go directly into your directives and protocols. So that's an easy way to have it right with you, because obviously everybody carries their phone absolutely everywhere now. It's just the way of the world. So that allows for kind of updates to be continuously in your pocket. If you aren't able to add paperwork, or if you don't prefer kind of having a hard copy of a book.
You could also, I mean, depending on your circumstance, depending on your habits, you can make a habit of, you know, on your way to your shift, flip it open, and then it's updating while you're on your commute. Certainly don't be browsing it when you're on your commute. But you know, if you want to make it a habit of opening it daily or what have you, so it can go through its update cycle, if that's more your style. Because I never remember to put my phone on airplane mode, up to and including being in an airplane.
So you're the problem. Okay, you're the problem.
Hey, we've never left one up there yet. It's fine.
Okay, I think one new question. We're up to 13 now in the chat. It was 12, so I don't know if the most recent is a comment or a concern.
Somebody's commenting. They're saying the medical references in the OBH is such a good reference, and yeah, I would agree.
Yeah,
and certainly I've been doing this now since
very extensive.
Yeah, I mean, I've been doing this now since 2018. I forget stuff all the time just by lack of not using it, or by virtue of not using it. I mean, I've never given hydrocortisone for an adrenal crisis. I would definitely have to look up my indications again, but that's the kind of thing where real world, I'd be doing it on the way to a call, just to refresh, and then I'll show up and be like, okay, I know this, we're good.
And that's the same thing with even the most experienced ACP, right? On the way to that pediatric seizure or whatever it is, the entire drive there is reviewing of the doses, calculating your weights for your seizure, your tube length, your all of this stuff, your epidoses if it does become a VSA, right? So constantly referring to those directives as well as that medical references section is such a great way to not only continue to build your knowledge and maintain your knowledge, but also prove to your instructors and your preceptors that, hey, you're really serious about this. It's not realistic anymore with the size of this book to be like, oh, it's fine, I just memorized them all. That's really cool if you know like these like 5 core directives, but as soon as you start working within 2 directives, or your patient has that sudden shift in mentation and status, and you have to jump into another one while you're being assessed for getting a job or not getting a job and kind of your future career, why would you risk that stress level and just kind of having that, okay, well, I memorized it, which is obviously good to do, but knowing that you have the ability to continually kind of refresh. So don't think, well, I memorized and I did well on my scenario in school, so I fully know this directive. No, like when you're going for a scenario the next day, read through them, just go over them, continuously test yourself on it, or test your classmates. Have your significant other just like make up a scenario randomly, like, hey, I'm 35, my name's Tim, and my chest hurts. What are you going to do? Like, okay, that's fun. Like you can make it interactive, make it different, right? Don't treat it as work and treat it as school. But as you go through it, just speaking as an evaluator and a past college instructor and marker, we see who practices and who doesn't. Like it's so ridiculously obvious who is putting the effort in and who is just skating by and being like, well, it's October and my final exam's in December, so I'll make sure I practice a lot in December. That's just straight up not how it works. So do the work throughout as you're learning. And I'm honestly so happy that a couple of the earlier in education people jumped in today. So like our first year and then the person jumping into 3rd term, right? Like you're not on the road yet and you haven't even really learned all the directives, but you were really willing to be engaged. And that's exactly the type of person that you see becoming a very successful student and becoming a paramedic nowadays.
Definitely. And I mean, further what Kyle said, it's not at all reasonable to expect that somebody will memorize their book and all the doses. And I'll take that a step further. In our environment, when you're stressed, the first thing that goes out the window is, you know, well, I just know it. People are very reactionary, especially when they're stressed. Especially, I mean, we all, or at least we try to have the attitude of it's not my emergency. So when I roll up on a scene, I'm not stressed. Hey, what's going on? I'm Joel. I'm your med tech. What can I do for you today? You need an IV. But
Yeah.
I mean, inside, I am stressed. I am concerned because that's my teammate. That's somebody I may or may not have deployed with. It's somebody I may or may not have worked with in the past. It's obviously going to be somebody that I care about.
Mhm.
So the thing is, in aviation, like my background in aviation, when something catastrophic happens, when that aircraft has a malfunction, it's a sterile cockpit, and then we go into checklists. Even pilots, some of the best pilots in the, I would argue, some of the best pilots in the world, they're the first thing they do is they go to their checklist, because that is not the time to just know things by rote. It is not the time to be the person who just kind of knows what to do. They're saying, no,
Yeah.
seconds
And
count. This is a win or lose, and I have to win. Follow the checklist, do it.
yeah.
So
And
you take
realistically,
it more.
that is their jobs, actually. Like there's no such thing as a pilot who is even allowed to be like, oh, I know this process, I won't read the checklist. Like if something goes wrong, that's how the FAA and that's how that profession has literally become the absolute safest profession on the planet, because everything is so double checked, checklists, and verified by experts before any step in action is taken. So it requires absolute expertise to be a pilot, but then you're running every single action past other individuals who have that same expertise. That's why they absolutely preach at the base hospital level and in the service hiring level. Your drug cross checks. Your drug cross checks are so important, right? Yeah, I know that I'm giving Advil and Tylenol. Cool. Okay. But you want to make sure that you're giving the appropriate dose. You want to do your 5 R's. You want to go through that stuff. And when you're in these scenarios, that is so important to give your to do your 5 R's and make sure that they know what you're talking about, and make sure that you know what you're talking about and why you're delivering that.
Yeah, I mean, definitely. I had a patient just yesterday, and it was a bit of a complex case. I had my physician nearby, luckily, and
Mhm.
even as I was going, just out of habit alone, even as I was going through, I was drawing up his med, and he was fine. He was, I mean, he wasn't fine, but he wasn't critical or anything like that. And I said, "What does this say?" And they read off the drug name. I said, "Great." I drew it up. I said, "What does that number say?" He doesn't need to know how to read a syringe. I can say, "What does that
Mhm.
number say?" Because I know where the plunger is. And it's just that kind of thing where, I mean, I'm very, very confident in my skills, but the last thing I want to do is to make a med error for the sake of, no, I got this, right?
Yeah. Use
And
the other
again,
people on scene.
certainly. And again, when we're talking about, if it's my mother, father, sister, brother, if they're in that seat, they're looking up at a paramedic who I want them to see, I would rather have somebody that shows a little bit of humility, that is not willing to accept that a mistake due to negligence is acceptable.
Mhm. That's exactly it. Cool.
Good dialogue.
Okay.
Really good
Yeah.
dialogue. Does anybody have any questions, any kind of anxieties looking at hiring prep? Anybody kind of making their way through the pipeline of school, and they're kind of looking at, where do I go from here? How does everything kind of play out? How does EMCA play out?
No. Okay.
Online
Mm.
service testing. Right off the bat, Kyle's gonna have a lot more feedback, and certainly Leslie, I'm sure you're gonna have a lot more feedback. The simplest, easiest advice I can give: treat it like a job. You're working from home, but you dress appropriately, put on your best, take some time to look in your background. If you have posters of various types, and I'll let you decide what those may or may not look like, maybe that's not the room that you want to do
Mhm.
your hiring prep in. Okay.
Yeah.
It's a job interview nonetheless. Doesn't matter where you are, doesn't matter if it's your own computer in your own home. Dress like it, and definitely act like it.
And online service testing, I'm not sure if you mean literally like kind of going in for the test questions, like your first step stuff. Because online service testing in terms of the questioning is just a standard test. Like it's just normal questions. So you just have to go through and kind of see the information that they're giving you, try and use standard exam techniques and methods, right? So eliminate 2 answers if you can, then you're down to 2 possible answers, right? It's usually A, B, C, or D. There's usually at least 1 to 2 that are just clearly wrong answers if you know the patho. And then if you aren't really sure, at least you have a 50% shot versus a 25% shot, right? So work through the questions. Don't ever feel like you just have to guess. utilize your experience and make the most of that. And then that's a perfect segue with the other next online step, because we have Leslie who has made her way in today. So I'm going to pass the floor over to Leslie. She's going to give a quick introduction, and then I'm going to jump into the presentation that she'll be doing. So thank you so much for joining us, Leslie, and the floor is yours.
Hello, hello. Are you able to, are this PowerPoint you're putting up there, Kyle? Or should
Yeah,
I put it up?
I've got the PowerPoint ready for me right here. If you have it up on yours, you can do it, and then you can tap through as you wish. Because I've made you a co-host now, so you're able to screen share and everything.
Okay. 1 second. And I'll do that now.
Fantastic.
Just 1 second. Okay, so I can't see any of you, which if any of you know me as a teacher knows I prefer to be able to see your faces. So if you felt like turning a camera on, I'd be okay with that. It kind of makes it feel like I'm not talking to myself for an hour, but whatever is comfortable for you. My background, for those of you who don't know, is I was a police officer for 17 years with the Ottawa Police. Glad I'm not there now. A lot of my coworkers are having a really rough time right now, so I'm sending them love and affection and support, but it's a cluster, and you may or may not, as a paramedic, see one of those environments sooner than later. But 16 years of law enforcement, different capacities, undercover work, school resource officer, community officer, did some private security on Parliament Hill, that kind of thing. Assisted with the essential competency interviews for police for several years, which are based on behavioral interviews. Taught justice studies for around 15 years and somehow found myself teaching in a paramedic program for the last 8 years, which I enjoy because the bulk of you, if not all of you, have a really good chance of getting a job, where in law enforcement, their parents told them to go to school and get something, and they all wanted to be a cop, so they took police foundations, and there was a whole plethora of fun stuff going on in there. So the job I have now is I teach medical legal. I teach a lot of the humanities, whether it be medical assistance in death, human trafficking, sexual assault, transgender issues, child abuse, that kind of thing. And I'm also a placement coordinator at another private school. Some of you know where that is. We won't discuss that further. But what I do there is I sort of gather information to help the students with their processing. And one of the most important things to remember is you will have spent a lot of time, a lot of money, a lot of effort, a lot of energy in your schooling. You need to make sure that you put that much effort into your hiring process. So this is just another little blippet of me. Anyway, so biggest thing is to consider when you're preparing for your interviews, you really want to make sure that you're putting the same amount of effort into that you put in your entire process. So the interview these days, obviously now is done online. There's still the behavioral interviews, and depending on the service you will go to will determine how many MMIs you will do. They're generally around 6 to 7 minutes a piece. So things to consider is your preparation. Everything from, as I believe it was Joel, I believe it said, being mindful of your background. It's a very different environment now when you're going for an interview because it's not face-to-face. It is in a sense, but the sort of the business nuances that we would take in a interview environment face-to-face are not the same as they are in an online interview. So as Joel mentioned, there are some things to keep in mind when you're doing an interview. You'll notice that my background is relatively clean and uncluttered. Try to be really centered, be mindful of my light. All of those kinds of things are important. So being mindful of your background, your Wi-Fi strength, who's in your home, if you have children at home, make sure your dog doesn't come into frame, make sure that you dress the part. I'm old school. No matter how young I look to you, and I'm just going to offer that up. I'm actually almost 54. Well, black don't crack. Almost 54. But when you go for an interview, you need to be mindful that the people that will be interviewing you will be the people who will likely be from my generation. Maybe some younger ones, but generally speaking, the people who will be interviewing you will be people who are in their late 30s, 40s, and 50s. Knowing that I'm old school means, you know, we were prepared with when you went for a job interview, you took it as a professional opportunity to wear a suit. I always suggest you wear a suit. And if anybody has met me before, you will know that I have two ways of speaking. One is direct and one is more direct. I'm also a Black girl, so that's the way I roll. So here's what I will tell you is this. When a lot of services say, thank you, Trevor, for turning your camera on, I appreciate you. When a lot of services say, oh, and there's Brittany, perfect, love it, thanks guys. When a lot of services say business casual, the problem with business casual is that, and I say this with love and respect, some generations interpret that very loosely, okay? Which means you guys will probably do service testing, interviews, things like this. Listen, the reality of it is there's probably a lot of people in their pajamas right now. Probably a lot of people wearing hoodies, baseball hats, probably a lot of hair all over the place, probably some really questionable background material. The reality of it is you have to prepare your interview for the people that you're going to be preparing for, not for what you think is appropriate or comfortable. The transition from where you are now to professional needs to translate into this concept of uniform, that everybody looks the same and everybody does the same, performs the same way. Think of that as well in your interview process. So be mindful of things like how you dress. I have students that listen to me, and you can take whatever I say with a grain of salt, obviously, who actually show up for their interviews with a suit on. And they immediately say, I was shocked to see how poorly everybody else was dressed. And I said, do you think you stood out? They said, yes. I said, do you think you stood out for the right reasons? They said, yes. You're young people who are trying to convince a bunch of professional people that you're mature enough for the job. And so the reality of it is, where you can wear a suit, and with all that's good and love and holy, please, if you're going to wear the suit, wear the whole thing, wear the tie, wear the shirt, wear it all at one piece. Someone student said to me, well, it felt like too much to me. Sure, to you in your average life, it probably feels like too much, but for where you're going, it certainly isn't. So just keep that in mind. Ladies, I always say to you, and listen, I'm old school. I'm going to offend somebody at some point. It's a given. So if you're offended by this, I apologize, but it's not meant to offend. You're not going on a date. You're going on an interview. So be mindful of the awning eyelashes, be mindful of the cascading hair and the full makeup, regardless of what you think, regardless of what the world looks like. People make assumptions based on how you present yourself. Clean, professional, not controlled, but clean and professional is probably the best way to go. So just consider, again, not preparing for a social environment, but preparing for a professional encounter. So just keep that in mind when you're preparing yourself. That's all I will say about that.
And I'm just gonna kind of jump in there, and I'm hoping that some of you guys can also speak to it and recognize. Some of you might not know who MedicSense is, what it is. You just saw, oh, cool information. I'd love to jump in on this. When you signed in, and I initially turned on the camera for this session, I'm not sure what your initial reactions were. You didn't know what to expect, but what you ended up seeing was a man in a button-up with a suit jacket on, hair done, like shaved, appropriately put together. And I don't know if it did or if it didn't, and that's completely for everyone to feel their own way. But for me, that would have kind of given me a little bit more of a, oh, okay, this is legit. This is a professionally put together. I'm excited for this information. I know what I'm going to expect almost, because this is that you kind of get to see that professionalism is the first thing, and the first reaction is this person's taking this seriously. I didn't just put out a link and say, hey, come get my information that I'm giving you. It's totally fun. You're going to learn a lot from it. And then I show up in a Nirvana t-shirt with a hat on because I didn't get much sleep last night, right? I'm presenting exactly, and how I'm presenting myself is how I feel about every single one of these teammates and all the information that we're going to give you. It's strong, it's great, it speaks for itself. Okay, so I hope that kind of thing also shows you that. And Joel, now that you're a co-host, are you able to admit people to the room? There's someone just trying to get in.
I was just able to do that. If that's
awesome. Okay. Thanks, guys.
And gents, a word on what Leslie's saying. I'm especially going to say this for the guys. It applies to the ladies as well. my pet peeve, because I look young. Most of the time I act like I'm 18. I am older, unfortunately. I'm getting there. It's a suit is not the opportunity to wear your freshest sneakers, at least not in the context of a job interview. Shoes, well taken care of, cleaned, polished. I mean, if you're going to the club, absolutely, you can wear a suit with no tie and a pair of sneakers, and that's going to be great. In the professional environment, I would be absolutely, if I were the interviewer, I'd be questioning your maturity and certainly your awareness of the gravity of what you're applying for.
Mhm.
And think in the current context of our society right now. Think in the context of scrutiny in the paramedic field. Think in the context of the generations. Think in context of healthcare right now. The reality of it is, and you look at how many people, there's 25 people in this session right now, okay? You guys know better than I do how many paramedic jobs are out there. You also know in ratio how many paramedic students are flooding the market at any given time. Services can say no. Services can go past you. Services can pass on you. And services don't have any legal obligation to tell you why they've done that. They will just tell you that you're unsuccessful. I would think that it would suck big time for you to spend 2 years or plus more of your life, upwards of $30,000 between education, service testing, everything else, testing, licensing, everything else, only to blow it on an interview. That to me would be the biggest thing I would regret. And for me, regret is not a thing because I try to live my life without it. But you're putting all of your time into that. So this is where we're going to remember what an interview is, guys, is they know you've graduated. They know you're capable. They know you can do the medical acts. They know you can rule in the protocols. They know all of that already. The question is now, who are you? Are you worth us taking a risk on? So it's all personal. It is how you manage conflict. Do you know how to play nice in the sandbox with others? Can you manage problems in the community without calling your supervisor every 5 minutes? Are you going to be getting in a fight with police and firefighters on scene? This is what we're talking about. Do you know how to manage the family as well as the patient? So just, again, not to belabor that, but you really have to put your best foot forward. And most of the people that I have assisted through the process have come back and said, you know what, I wore the suit, I felt a little uncomfortable, but everybody else was in track pants, baseball hats, I felt amazing. Somebody actually pulled me aside afterwards and said, you looked really, really good for your interview. That's the kind of stuff you want them to remember about you. If you're going to stand out for the right reasons. So again, the interviews you're looking at now are called behavioral interviews. They're based on who you are and your core competencies as a person and a professional. So it's important to understand what the themes are currently in the context of the MMIs. It doesn't matter if you go to Moose Jaw, it doesn't matter if you go to Niagara Falls, it doesn't matter if you go to Toronto, the concept and themes of the questions will all be the same, okay? So when you're trying to prepare, and I've heard several students come back to me and say, oh, I heard a paramedic say you can't prepare for the MMI. Okay. Again, I'm not a paramedic, never been a paramedic a day in my life. I will never second guess a paramedic. I'll just tell you the way I do. And the success that I have with my students and the conversations I've had with all of the education unit superintendents who have said, yeah, you're on the right track. So important when you're doing your questions to map out your answers. The worst thing you can do in an interview is in the middle of the answer go, what did you ask? Can you repeat the question again? Okay. When you guys go into interviews, the most important is our interviews, when you guys do scenarios, and I haven't seen any of you, well, several of you have seen do scenarios, but not all of you. First thing you do when you walk into a scenario is you should be taking a breath and assessing your environment, right? In my world, we call it officer safety. In your world, you call it situational awareness, right? Taking in the totality of your circumstances. Best thing to do to compose yourself is take that breath, right? Settle yourself, get your heart rate, slow your heart rate down. One of the things when you consider before your interview is, so some of you may be dealing with anxiety, life anxiety, interview anxiety. I'm 53 years old. I still get interview anxiety. Okay. What I do when I have an interview is I always log in, because there's usually going to put you in a waiting room anyway. You log in and you just spend a couple of minutes, Everything is prepared in front of you. Make sure you've gone to the washroom, make sure you've got your water for dry mouth, and just start taking a couple of deep breaths. Yeah. When we talk about law enforcement, we talk about the warrior mindset. You really do have to prepare your mind when you're going into battle. And in this current climate, your interview is your battle, right? We've talked about this. When you guys go into it, exams, I often see students with like piles of paper sitting in the hallway 5 minutes before their exams going, I got to get into my brain. Reality of it is, if it's not in your brain 5 minutes before the exam, it's not going to be in your brain. So trying your best before the interview, clear your schedule about half an hour minimum before your interview, and just practice, get your clothes on, get your hair right, get your suit right, double check to make sure everything in your environment is controlled, and then just sit in that chair and practice your breathing. Okay. Good night's sleep, obviously. No such thing, and it's a teacher thing and it's an EMS thing. There's no such thing as on time, there's only early, right? Because if you're logging on with your computer, who knows, maybe your power is going to glitch that day. Maybe you're going to need to switch to your phone last minute. Making sure you're prepared is really important. Okay. I've talked about this before. Joel used the fresh set of sneakers. I'm old, so I call it Cedric the Entertainer. You know, no one's checking to see how fly you are during, you look at all you young people don't even know who I'm talking about. That's how old I am. So Cedric the Entertainer, this is not what we're talking about. We're talking about crisp and clean and professional. Okay. Please listen to me when I say, what's that, Joel?
Nothing's wrong with Cedric, to be fair, just not on an interview.
Nothing's wrong with Cedric. Just none of you will know what I mean by a zoot suit. Make sure that you're wearing the full uniform. Don't half-ass anything. If you're putting on the jacket, put on the shirt, put on the tie. If you want to be business up front, party on the bottom, you do what you got to do on the bottom, wear your Bart Simpson boxer shorts, whatever it is you got to do, but make sure that what they're seeing is exactly what they expect in a professional.
And with that, she kind of said to wear everything properly and use the kind of the uniform term. Do not wear your uniform to your interview, please. Nobody wants to see you in a uniform, okay? It's not well, that's what I'm going to wear on the road, so I thought they might want to see that. You are going for a business interview to work for a corporation. You're going to likely see representatives from HR there. You want to be presenting yourself for the business role. They know what you're going to wear. They buy everything that you're going to be wearing. They know everything about it. You also don't want to be wearing your patches from your school to your interview. You're not representing your school. You're representing you. Okay. You're representing how you are going to be sold and how they are going to want to watch you walk away and talk to each other and say, Jesus Christ, we need that girl. She has a head on her shoulders. She's absolutely well dressed. She was answering our questions. She made us definitely recognize that she knew what was going on and she actually crushed it. That's how you want them to feel at the end of it.
The other thing to consider is this. If they were to ask you in the interview, if you're sitting there wearing a suit and they would say, Joel, did you not get the instruction it was business casual? My response would be, I certainly did. However, I have one opportunity to make a good impression as a professional, and this is how I choose to represent myself as a professional.
Absolutely. And business casual as well, just to tack on to what you're saying, Leslie, it's very subjective. So for example, in my work environment, even in the military, we do casual Fridays. Today, I was literally wearing jeans and a t-shirt, and that's not something that I want to wear to an interview, even if it is deemed to be business casual, because then the next question is which business and how casual.
Just for your volume's a little low, Joe, but let me ask you a question about the jeans and the t-shirt. Were the jeans and the t-shirt clean, and was the shirt a good shirt?
So when that's the other thing. So can you hear me better now?
Yeah.
Okay. So when I arrived at work, I had not the sweater. I had a different sweater on. It was very business appropriate. It was, in my opinion, it was smart. And then as I started getting into patient care, it was kind of getting in the way. So I was down to my t-shirt. It was red for Red Friday. And that was that. I had my Super Mario Brothers 1-Up belt buckle. But again, in my environment, in my clinic, knowing who I work with and my patient demographic, for me, it's a good icebreaker. It's a good way to start a conversation, especially if, a patient is a bit hesitant with me. They'll say, hey, I like that. And, my next thing is, well, I'm a medic and I do believe in the extra life kind of thing, right? Again, though, you're probably not going to have that opportunity in your job interview. And the problem is, again, business casual is very subjective. Sure, you can be overdressed. You can very quickly strip that down by removing a tie, maybe unbuttoning the top. But if you have jeans and a t-shirt and that's all you have with you, it is very, very difficult, if not impossible, to dress that up.
And not everyone's going to be as fortunate as you to have your wife dress you in the morning before you go to work, but just do your best to follow our tips.
Ouch. But yes, she's wonderful. Thank
I
you.
believe you paramedics call that as found. Okay, so when you're talking about the interview itself, again, what we're talking about here is they're trying to figure out who you are. Can they take a risk on you, put you in their uniform, pay you $100,000 a year and drop you in any community in their service, and you're going to be getting commendations, not complaints. So when you're talking about, when you're in these interviews, again, as we said, in normal circumstances, in a face-to-face environment, these would be, you know, it could be like speed dating. I did speed dating once, never did it again. The guy before me, the guy who was supposed to, the bell rang, the guy was supposed to come and sit down, nobody sat down. She's like, we've never had that happen before. I've never been to speed dating again. In this environment, your people will show up at the desk when you sit down. So in this environment, it'll be, they may put you in little individual groups. They may put one have sit you down and just ask two set of people, might just ask you the same questions. The format will be specific to the service, okay? So what I want you guys to consider is, I want you to be mindful even of your language, okay? There's casual language and there's more formal language. When you're answering questions, anytime, and in my mind, anytime you're referring to the Paramedic Code of Conduct, which remember, the entire MMI interview is predicated on the Paramedic Code of Conduct. Everything that they ask you is predicated on the Paramedic Code of Conduct. So for those of you who were in my class, I beat you over the head with the Paramedic Code of Conduct. For those of you who are not, Brittany's smiling, she's like, yes, she did. For those of you who are not my students, I encourage you to read that Paramedic Code of Conduct as many times as you possibly can. Don't just read it, but understand the context of why they're asking you those questions and why that code of conduct exists in the first place. They're not going to be asking you how to put on a KED. They're not going to be asking you how to auscultate. They know you know how to do that. So now it's a matter of what are your competencies, whether it be talking to people, your nonverbal skills, situational awareness, whether it be how you work in a team, etc. So one of the things I would strongly suggest going into an interview is to know your resume inside and out. What I mean by that is they don't care that when you worked at Starbucks that you had to swirl the espresso machine. But what you did get from that job is the competencies that were required to do the job. So for example, if you worked at Starbucks, you had to deal with people who were coming in as a-holes first thing in the morning who hadn't had their shot of caffeine yet, who were rude, disrespectful, and you had to maintain your composure. You had to use good oral communication. You had to utilize emotional intelligence, which is self-regulation, empathy, self-awareness, what your triggers are, knowing your face, if you've got resting B face as a male or a female. So all of those skill sets that you got from the job are what you should be referencing if they ask you a question about your resume. So for example, Leslie, talk to us about your resume. So I would pick one job on my resume and I would speak to that specifically. I would say, okay, what are they actually asking me here? Keep in mind, when you're asked an MMI question, they want to know what your skill set is. So the second they ask you a question, the first thing you have to do is identify the theme of the question. So I'm going to skip quickly on my slides here, okay? So the first thing to do is identify the theme of the question. If they say to me, Leslie, tell us about your resume, they're not asking what every job and every menial task I did in my job. But I do want to say, okay, what they're asking me here is where did my developmental competencies come from? Where did my core competencies of team building, written and oral communication, task orientation, physical readiness, where did those skill sets come from? So the first thing I would do when it comes to my resume is I would maybe speak about one of my teaching positions. I would give them a brief overview of what my general responsibilities were. And then I would talk about the things that I did that mirrored or echoed those competencies. So if I worked at Starbucks, I would say, when I work at Starbucks, it's a face-to-face human interaction kind of position. which means I'm meeting people from all walks of life, all socioeconomic statuses, even though with a $7 Starbucks that might be in question. However, I call them college coffees. Whenever I have one of those, my daughter can't go to college. When you are answering these questions, speak to those things. So it's a physical job. You know, I'm constantly have to go in the back to, you know, get boxes of coffee from the back. So you want to break it down into elements. I'm talking about a job. So I'm going to pull out and talk quickly about the things that reflect the competencies. In paramedic, it's physical readiness. So if you worked a job where you had to be physically fit, I would mention that. If you had a job where you worked with people, I would mention the range of people that you meet and how you had to be flexible in your approach to different people. If you had to manage conflict, I would want to talk about it and reference. For those of you who weren't in my class, maybe you don't know, well, you probably know about emotional intelligence, but sort of talk about, you know, having self-awareness, knowing that it's not about you, which is that empathy, regulating your behavior. Remember, wherever possible, reference kind of this representing a brand idea or this ambassadorship idea. If you look in your paramedic code of conduct, one of the points says, the paramedic shall conduct oneself in such a manner as to merit the respect of the public for the profession. Okay, which means you're a brand representative. When you wear an Ottawa police flash, a flight medic flash, a Toronto medic flash, you are a representative for that brand. Again, in EMS, never more important now are the sense of optics and how you represent that brand. Mm-hmm. So when you say, yeah, I have people that are coming in that are upset, but I really know it's not about me. So I take a deep breath. I know that I don't buy into that. I understand that I'm representing myself, but I'm also representing the brand. And then at the end of everything, when you kind of hit off those points, round it into being a paramedic. I know as a paramedic, I'm going to be working with the public, and most people, when they call 911, they want paramedics there. However, not everybody is happy to see paramedics. We're seeing right now in the field a lot of aggression to authority directed against paramedics now. We know that assaults against paramedics have gone up. And so it's going to be really important for me to use the skill sets I developed at the Starbucks job in managing conflict, regulating my emotions, understanding I'm representing a brand, that when I'm wearing your uniform, that I will be able to do the same thing. Mm-hmm. What I can't see your faces, so I can't see the nods of acknowledgement, but can you give me maybe some thumbs up on your screen so I can see your sort of understanding where I'm going with this? Okay, so really important for you to not only then describe one job, highlight a couple of points, pull out some of the core competencies of being a paramedic. And if you like, if there's a break, I will pull those up really, really quickly and I'll show you what those are. But it's things, again, like I mentioned, physical readiness. If you did a job where that was important, I would highlight the fact that you know that being a paramedic is very physically demanding. If you work out, I would want to make sure that you say specifically, I have a lifetime dedication to physical fitness. And then always that kind of statement will turn into a mental health statement. So in other words, as a paramedic, I know that physical fitness is not only good for me physically to maintain fitness, to be able to be healthy and do my job for longevity, but also good for my mental health. Okay, so when they ask you about your resume, again, not asking you about the day-to-day jobs you did. They're talking about the core competencies that you would have built in those jobs. Pick one job, talk about it briefly, and then provide an example from that job that reflects those competencies that are translatable into EMS, okay? Mm-hmm. And then my students have heard me say before, it's not enough to lead a horse to water, you gotta slam its head under the surface. So what I wanna do at this particular point is I wanna, remember, by the time you've left that interview, you want them actually visualizing you in their uniform. So mm-hmm. I'm confident, not cocky, but I say in an interview, when I'm working as a Toronto medic, I understand the importance of representing that service, representing their members, and representing the profession. And you can put me in any community in the city of Toronto, and I will represent myself to the best of my ability and my profession. So you see how kind of that subtle little thing of saying something about you and their uniform and then talking about their city, it rounds out the answer. Okay, so just when they're asking the resume question, that's the kind of thing that they're looking for. Okay. The other thing that you need to do is you need to remember or refresh yourself on some of your medical, legal, and ethics. When it comes to your interviews, they're going to be asking you ethics questions. Okay. You see something, you hear something, somebody doesn't do something, somebody does something. Okay. Again, your paramedic code of conduct has something specific in there that actually speaks to ethical conduct. A paramedic shall report any unethical, immoral, illegal behavior of any other health professional. Okay. I know this, I teach it. You guys are gonna need to know this, you do it. So refresh yourself. When it comes to the paramedic, when it comes to any legislative questions, so if they ask you a question about something that was a violation of privacy, either health information that is offered orally, shared orally, or in document, you need to remember what your role is under PHIPAA. You are an agent. Your service is the custodian. As soon as you are aware of the breach, the breach, you have a responsibility to act. Okay. When they ask you a question that relates to ethics, you're going to have to break it down. So if they ask you a question, say, Trevor is a student who works for a research or an organization that's working for your service. Trevor says to you, Leslie, I've lost a USB and it's got the names of people and their health information. What do I do? Well, the response is, in your head, what are they asking me here? This is an ethical question. This is a privacy question. It's a procedural question. What do I know? What will I do? What's my policy? What's my responsibility? So yeah, as you say to yourself, this is a privacy question. So the first thing I'm going to do is I'm going to say, well, if I understand this question correctly, this relates to privacy and confidentiality. PHIPAA, reference the legislation. PHIPAA regulates the collection, use, and disclosure of personal health information. I, under the Act, am an agent as per the Act, which means as soon as I become aware of the loss of this information, I have a responsibility to A, assist that individual with looking for it, B, report it to my service, who is my custodian. That will have satisfied my due diligence. Okay, so where there is legislation, if they ask you a question that relates to child abuse, I would reference your child in need of protection standard. Reference your role as a person in authority under the Child and Family Services Act. So you need to remember that the medical legal that you would have taken in school, you need to remember that that still is necessary to remember in your interviews. So if you don't, I don't know where all you guys went to school. I know that I teach MLIE extremely in depth. So if you remember, if you know they're going to ask you a privacy question, if you know they're going to ask you, your partner shows up, they're under the influence of something, you need to understand that the Highway Traffic Act, the Occupational Health and Safety Act, all of these things relate. And so they want to know that you know the legislation specific. I would suggest there will probably be more ethics questions than normal based on the findings of the case in Hamilton. You know the services are going to be asking you a lot of ethical questions, okay? So keep that in mind. Remember that whatever happens in your field of study directs what happens after that, okay? So I would suggest refreshing yourself on the Mental Health Act, Child and Family Services Act, PHIPAA, Highway Traffic Act, Occupational Health and Safety, inclusive of your workplace violence legislation. I would refresh yourself on that as well. PHIPAA for sure. You may want to even just review the Human Rights Code and the Charter of Rights and Freedoms as it relates to patient autonomy to make decisions. Okay. One of the things you have to remember, and Joel and I will probably understand this better than anybody, is chain of command is a thing. Okay, you are going into, he's nodding like a black girl in church. Look at him. You are going into a paramilitary organization. I love paramedics. I was shot in the line of duty at the beginning of my career, which is why I'm no longer a police officer. The first people to lay hands on me are paramedics. I love me some paramedics. But so I say this with love. A lot of you don't really embrace the concept of command and structure and paramilitary organization. It's your career has a lot of black and white, has a lot of gray in it. And there's also a lot of interpretation of paramilitary organization. You guys are going into the same job as police and fire. We have rank and structure, we have uniform, we have code of conduct. You need to remember that. So when you're going into these interviews, it would also be really important to acknowledge your understanding of what a paramilitary organization is, what a chain of command is. So in expressing your understanding of the environment you're going into, that was one of those things you can consider as well, okay? Your protocols, that's not my arena, I won't speak to that. But the other thing I would say, when you're researching your service, and you should be researching every single service you're interviewing for. Difference between you guys and police, we pick a service, we apply, that's it. Okay, you guys throw out a wide net, you apply to 5, 6 services. And so it's kind of like dating 4 girls at one time. If you're trying to convince that 5th girl that you're really into her, you're probably not dating her friends at the same time. Okay, and the way you prove to a service or a girl, wink, wink, that's free advice right there. The way you prove to a girl that you're into her is to learn as much as possible of her, what color her favorite flower is, what her favorite wine is. Those are the first 2 to start with, by the way. And you learn those. So though you'll throw out multiple applications, please keep in mind that when you're interviewing, you must research the city and the service in detail. What are their partners? What are their community partnerships? So if they ask you a question that relates to, and I'll tell you right now, some of the services are saying, the questions are as simple as, Joel, how do you function in a multicultural society? Or they'll ask you a question like, give us the name of 5 marginalized communities and some resources for you to use them, to refer them to. So what we're talking about is we're talking about youth at risk, LGBT, Indigenous kids. This is what we're talking about. We're talking about elder abuse. We're talking about domestic violence, all of those things. So knowing that being a first responder is not a lone wolf thing, you have to tag into your resources outside of your service as well. So whatever city you're applying for, you best go online and research some of their services. Go on their website. If your service is volunteering with boots on the ground, then talk about boots on the ground. If your service is volunteering with youth at risk, then you want to talk about that as well. If you are looking for volunteer work, volunteer where your volunteer where your service is volunteering their time. Okay, the best way to show a service, and you got to remember, one of the biggest challenges services have right now is retention. Okay, you guys will accept a conditional offer of employment. You'll start 2 days before you start work. You'll go to another service. 2 days after you start orientation, you'll go to another service. 2 days after being on the road for the first time, you go to another service.
And that's a huge problem.
Services right now have a major problem with this, because on average, from interviewing to the end of orientation, costs them about $30,000 a candidate. Okay, so the services right now, in conversation with a couple of them, they're actually talking about retention programs, where they're now suggesting that they may be genuinely looking at making you sign a contract for 2 years. And if you leave before the 2 years at the end of the contract, you will have to pay back that $30,000. So again, one of the things I would really want you to consider is, if you live in Peel and you're applying to Peel, sell the fact that you live in Peel, that you've grown up in Peel, that you work, play, fornicate, whatever it is you do in Peel, sell the fact that you do it in Peel. Okay, if you work in another jurisdiction, say I live in Hamilton and I'm applying to Niagara, I sure as hell better be able to explain, am I understanding of that community, in order to guarantee, to say to them, yeah, I really want to work here. Because they're very hesitant. There's a reason why Niagara really only hires from Niagara, right? It's annoying as crap to everybody else, but they know who they're training, and they know that they're going to stay there. Okay. The reality of it is that even in policing, when you can't get into a service, you apply to Toronto policing, you do a year or 2 there, and then you go and work in the service you really want to work for. When you go to your interview, do your best to research the city, research the service, the community resources and the community partnerships that that service has. Speak to that intellectually in the interview, and it shows you're really into them. Okay, really important.
It's huge.
Okay, so when I was talking about themes, I mentioned ethics, misconduct, ambassadorship, wearing their uniform, service initiatives. I have students that are in York right now. York, just a couple of years ago, made a really good partnership with Boots on the Ground for this community partnerships your services are now making. It's really important for you to know, find out about that girl. Find out what color nail polish she likes. Find it all out, okay? Find out everything. Conflict is always going to be a question. Resiliency now more than ever, especially in a COVID climate, especially when most services are operating at about 50 to 60% of their capacity right now. When you have uniformed superintendents and commanders that are working trucks right now, it's mental health now is bigger than it ever has been before. You have to be able to express to them your understanding of the stresses of the job. And the reality of it is, you guys lead the statistics in suicide and divorce. So they want to understand that you understand what the job, what the stress of the job is, and that you are conscious and mindful of making sure that you're preparing, fortifying yourself as much as humanly possible to prepare for the stresses of the job. We're now starting to see first responders with less than 2 years on the job off on long-term on sick leave, mental health leave, stress leave, and long-term disability. So nothing wrong with any of those first responders, but when you go into an interview, you have to explain your understanding of why self-care is so important. The other thing I would mention is, in this current climate, I don't know if you guys have ever studied psychological first aid. We do that in my classes, which is basically the rendering of aid. Instead of it's a Band-Aid, it's to their psychology. So it's looking out for your fellow man, AKA your brothers and your sisters. So when Kyle, my partner, comes to work, or Kyle is on my platoon, and maybe I don't know him as well as Joel, my partner, but when Kyle comes to work and he's looking disheveled, he's unfocused, he's scattered, he's got his demeanor is changing, I'm not going to go, what an ass. I'm going to say, I'm intellectual enough as a new generation medic that I know that that may not be what it looks like on the face of it, that maybe he's struggling, maybe he's experiencing post-traumatic stress symptoms, and I should probably walk over to him, even if I think he's an asshole, and go, Kyle, I noticed that your demeanor's changed a little bit. Are you okay? And know, as a paramedic candidate, that there are resources within the service to support you. Okay, but also that there are services outside. So know what some of those peer support groups are and what they're doing. Okay, it's not enough to buy the sweatshirt, the I've got your back sweatshirt, which is awesome. It is where that funding is going and what the funding is doing, right? So your resources within and your resources outside of the service. You don't have to know exactly what's going on inside a service to know there are peer support medics, there are health and wellness units, there's benefits for mental health with your union, etc. Okay, so when you're talking about self-care resiliency, they want to know that you understand, whether it's a question about you, and some of them are asking directly, they're going, Jessica, how do you define resiliency? Well, they're not asking you for the Funk and Wagnall's definition of resiliency. They're asking you, do you know how stressful this job is? Do you know what's going on in your future community? Are you taking steps now to prepare yourself for where you're going? And those are self-care questions. If they ask you that question about yourself, that's one thing. They ask you a question about you're noticing the behavior or the demeanor of your partner changing. This is identify the theme. It's a resiliency self-care question. So what I want to do is I want to explain to them my understanding of resiliency, not the definition, but what that actually means in the context of a first responder job. Then what I want to do is I want to talk about my understanding of the job and the stresses. I want to talk about what I do to manage my stress. So whether it's talking about meditation, running, gym, taking a bath, getting away on your days off and changing your environment completely. It's this openness and willing to talk to somebody if you notice your own symptoms or your own behavior is changing. And then it's a matter of acknowledging that, this job is going to be stressful, and you know what the resources are that are available to you to take advantage of should you be in that position. Okay.
Mhm.
They will always ask you a diversity question. If you work anywhere from one side of the earth to the other, no, sorry, that makes it sound like it's flat and I'm not that girl. Start at the top and go all the way around. And vaccines don't work. I'm kidding. What they want to know is that you understand, like, this is, and I joke around with my students and they say, how do you function in a multicultural society? And I had one student say, well, I got some friends that are Indian, I got some friends that are Black. And I was like, this is not the I know a Negro game. This is, what do you understand about different cultures and how that will affect? Okay, just so you know, I'm the only one that can say that, by the way. Don't try and use that in a future PowerPoint, Kyle. All right, I can't see, but your light's throwing me off. Okay, so he's like, I can say it too. Okay, so this is not a matter of, this is an acknowledgement, not of where you live and how you interact with other people. It's who will be your clients. Do you understand that there are nuances between, so think about, the people who come from different countries who have a mistrust of a uniform already, whether it be military, police, okay? How does that create an impediment or a barrier to your treating them as a paramedic? So these cultural questions, these diversity questions are about knowing your demographic, okay? In my class, we do in a gen ed, which looks like a fluffy course, we pick about 8 different cultures and subcultures. The students do presentations. They talk about the history of the country, some of the challenges, what precipitated immigration to our country, some of the rituals, food, celebrations, because your service is going to be flying a Diwali flag or a Kwanzaa flag or some kind of flag where what they represent as important to them is also going to be important to you, right? It's about, do I know that in some homes that as a male medic, I might not be able to take the assessment of the female patient, and that if a male is refusing to talk to me as a female, it's not going to be about getting my back up and like, you're going to talk to me. It's a matter of, this is a cultural thing and you need to acknowledge that. Okay. So again, if you were to go to your community, if you work in Niagara, if you're applying in Niagara and you speak Spanish, I am just that kind of girl. I would bust out in Spanish in the middle of my interview. When I worked at Niagara College for a couple of years as a professor, I researched the city of Welland, which is 12% French. And in the middle of my interview, I broke into French. They had no idea what the heck I was saying. But then I said to them, I have researched your city. I know that you have a large French population here, which means you're going to have French students, which means I have a language ability to assist some of those students now. If you speak a second language when it comes to that multiculturalism or that diversity question, if you speak a second language, tell them you speak a second language. Don't assume because you put it on your resume, and God willing, you put it on your resume. If I did it, you would have. If you put it on your resume, make sure you mention it, right? Whatever you put in your resume, you have to be able to reference in your interview. Okay. So I speak 3 different languages. I would probably mention that in my interview. Okay. So the cultural questions are really, again, researching the city and the demographic of communities that you will deliver pre-hospital medicine to, okay? And then speak about their culture, speak about, what is important to my service is important for me, and that will help round out that question, okay? Kyle, you were gonna add something, I think.
Yeah, just with the you and your resume thing, a lot of these things that you're mentioning are great, and you keep kind of referencing how in your class you'll go through this and you guys are able to do these different things. A lot of the people that might be in here or are going to see this eventually haven't had the pleasure of being in your class. And realistically, I can speak with some of the newest hires that we have on in the conversation when you're at base. Oh, where'd you go? Oh, I went to X college. Oh, do you know so-and-so? Yeah. Oh, how was your experience? Incredible. And what are they doing? They're wearing a uniform, working in my base with me for a paramedic service. So it just speaks to how you're obviously on to the right thing. And anyone who doesn't really know kind of Leslie or kind of had any of these different things in school, or I'm so lost with my resume, like what is this psychological first aid, or how do I make myself actually better and build up to present myself more than just that standard coming out of paramedicine with my resume that says I worked at No Frills, I then worked at American Eagle, and then I served at the KEG, and now I'm ready to be a paramedic. Those are just completely different things. So I don't want to interrupt the interview stuff, but if you have resume questions and resume building stuff, Leslie is such an incredible resource. So you can reach out to us after, and we're going to have probably a little bit of time after. So Q&A side, just jump in as much as you want with them. Utilize us three and ask every question that you can possibly think of, because that's why we're here today. So I just really wanted to touch on that and let you continue with the rest of this really good presentation.
And just before, sorry, Leslie, just before you move off the slide.
Sorry.
My apologies. Just before you move off the slide,
Yep.
2 points that I want to touch on to really drive the point home. So in terms of self-care and resiliency, it is not, and I've met some people in various capacities, not certainly just in paramedicine, in the military, in the police, and fire, etc. At the outset of their career, it's very easy with a limited understanding. Sorry, my fur missiles are getting a bit rambunctious here. Sorry if they interrupt. It's very easy at the outset of your career to say, you know, nothing really stresses me out. That's not a fair assessment, because if emergency services will prove anything whatsoever, every person working in emergency services has a breaking point. For everybody, that breaking point's different. Some people can go through PEDS call after PEDS call and be just fine, and they have one strange geriatrics call that resonates with them, and that's enough. You know, that one call, that one off is enough. It could be a workplace conflict. It could be policy and navigating diplomacy, or diplomatically as it may be. So it's not a fair assessment. Do some soul searching prior to your interview. And if they ask you what stresses you out, answer honestly. But as Leslie said, make sure you have a plan of, I'm aware that I'm stressed when this happens, and also this is how I manage my stress. And when I can't manage my stress by these means, this is how I know it's time to reach out for help. Because I would rather have you off for 2-3 weeks, whatever the case may be, while you seek care and while you get back on your feet, than to, you know, you're Johnny Bravo, nothing gets to you, and then you break hard and I can't fix you, and I've just lost that asset. Because at the end of the day, I mean, we manage people, we're in the business of taking care of people, but EMS, as Kyle said, it's a business. You're representing a corporation, and we being EMS hiring, they need performers. The next point then, for diversity language, and I want to be very clear that we're absolutely not opening the floor for any kind of debate, whatever people's opinions are on the matters, not the forum. However, if you do have opinions for or against or different from what is commonly accepted for any marginalized groups or misrepresented communities, certainly not the forum to voice that. Because at the end of the day, as paramedics, as police officers, as firefighters, any kind of emergency service, if someone is crisis, we respond, we take care of people. It doesn't matter race, creed, color, orientation, whatever the case is. So make sure you are very careful about how you represent yourself in regards to that. The other side of that, though, is you have to mean it. If you say, I can provide care to anyone, you have to mean that. And I say this in all manner of respect. If you can honestly see yourself hesitating to provide care, or if you can see yourself failing to provide adequate care or care to the complete scope, to your best abilities, to any marginalized culture, I'd respectfully offer that maybe pursuing other career avenues would be more appropriate. And again, I don't say that in any kind of judgment of your competence or in terms of your abilities. It's just that by virtue of what we do, everyone is the same, because everyone is a human being. Everybody's entitled to a measure of dignity, respect, and care.
Yeah, and this kind of leads into, I've actually just spent pretty much the entire day putting together a lesson plan on unconscious bias. You know, without referencing the case of the paramedics too much, the judge they brought in an expert on psychology, and they also brought in the expert on psychology, and the judge actually writes in his finding that the judge believes that unconscious bias was present in the patient care of the two paramedics. In no way, shape, or form suggesting that they were racist at all. There was absolutely no thought or possibility of that at all. But you know, on this topic of diversity, again, you have to be very careful of what you express in it. It's a fine line between answering the question honestly and disclosing too much.
Mhm.
Keep in mind, your BLS paramedic code of conduct is very clear, based human dignity, respect and dignity, based human care based on human need, treating everybody with dignity and respect. If they ask you questions, now listen, is it possible that, if they ask this, you may think that all gay people are, going against God's will and are going to hell. If that's your personal belief, you are welcome to hold that belief. The Charter of Rights and Freedoms guarantees that. But you cannot put this uniform on and bring that into the arena with you. It will temper your patient care. So they're asking these questions not because they want you to tell me, well, what do you think about Black Lives Matter? Cállate la boca if they ask you those kind of questions, okay? Ne parle pas. Don't answer those questions.
Mhm.
Just say, everybody in Canada has the right. Reference your Charter of Rights and Freedoms. Reference your Human Rights Code. Just say, I have always been one who is open to different opinions, and I interact with everybody, and I base my interactions with them on the merit of that interaction. When I'm wearing a uniform, you represent what your service represents and what your paramedic code of conduct represents, as well as the oath you will take as a healthcare professional,
Mhm.
right? So again, Joel was absolutely astute in making the caution. Be very careful how you answer those kinds of questions. Try and answer them generally from the perspective of how you approach different situations, cultures, and people, and what your understanding is of the requirements of you as a paramedic and the profession and as a healthcare professional.
Mhm.
And then Leslie, do you in this lecture, not to get off topic or not to steal away from me if you're going to cover it, do you talk about social media platforms and
Oh, yes, I
how that?
do.
Okay, great, excellent.
Oh, yes, I do. Well, let's talk about that right now. The reality of it is the second you put your reference in, the second they're calling you for an interview, they're Googling you 6 ways till Sunday.
Mhm.
Okay. You can try and find me on social media. I'm locked 6 ways till Sunday. Okay. Personally, I don't think there's anything interesting about my life that people outside of my life would want to know in the first place. That's just me. Be mindful. When I'm going to give you an example. There was a supervisor with a service in Southern Ontario. That supervisor got to keep in mind, supervisors don't have the same level of association protection that you guys have as paramedics.
Mhm.
Somebody went on this individual's social media, went back 3 years, found a picture of somebody in the States. She had her arm around wearing a MAGA hat. That person then forwarded that to professional standards, and that person was sent a disciplinary notice. They were not able to know who made the complaint. And this person was then, a judgment was rendered against this individual based on the fact that there was somebody went fishing in their social media and found a picture from 3 years prior. So I'm going to let that marinate for a second. And then I'm going to let you know that if it's a matter of optics and judging your appropriateness for the role now and in the future, and judging your character based on who you associate with, in a
Mhm.
perfect world, would that matter? No, but in a perfect world, I'd be size 5 and married. So we know that disappointments come. Okay. The reality of it is, sorry, it's just about me for a second.
Do you need to talk or?
Oh, you just asked me, do I need to talk? Mental health, yay! Thank you. The reality of it is when it comes to, I lost my train of thought. The reality of it is when it comes to your social media, there is no such thing as private. If you post it, it's out there. What your friends do, what they post. When I was doing police foundations, my students were showing me their profiles and I was like, ay, Madonna. And they said, what's the problem? And I said, your douchebag friend has a picture of wads of cash and a gun on your, well, it's not it's not me. Would I want to take a risk on you, putting you in that role if these are the people you associate with?
Mhm.
So what I would suggest to you is clean house. Go through your social media. Ladies, I say this with love and respect, but if there's pictures looking at you on their social media looking like you're making the walk of shame in the morning, take that crap off.
Mhm.
Okay? Pictures of you lit, picture of you, even just the stuff you comment on. Okay? The world is very tense right now in politics,
Extremely.
in conflict, in vaxing, in politics, in social groups, in race. We are living in a tinderbox right now.
Mhm.
Yes, you have the right to have an opinion. Yes, they have a right not to take a chance on you.
Yeah, and
So
just
I'm not-
remember, sorry, with the vaccine thing, especially right now, that's going to be something that's huge with the social medias. You can have your views again, like we've kind of talked about, but remember that we are under the public health umbrella. EMS is employed by public health, no matter what region you work in. Their direction is vaccination is going to be the absolute savior. So you can have your views, you can do what you want to. That's the beauty of freedom of choice, realistically, to an extent, right? If you're working in healthcare, you have vulnerable sectors, that's all blah, blah, blah. It doesn't matter. For the point I'm trying to make is don't be that person who gets into the argument one way or another on Facebook. You can yell until your mouth is completely out of air, until your lungs are empty, your face turns blue. You can argue. All that shows them is you're someone who is not emotionally intelligent. You're looking to pick fights. You're trying to do different things that aren't really strong characteristics that they want to, again, take that risk on. Because if they're seeing your views just on paper, how do they know how you're going to react in person, or how are you going to be overall? So I just want to make sure that we're taking those steps appropriately. But again, I'm not sure how much Leslie has in this presentation. We want to make sure we get to some of the interactive questions. So I just want to make sure we're not spending too much time on hitting certain things home. So I've got a couple interview questions that we want to go through. So Leslie, if you have one in your presentation that you really wanted to hit in, awesome. If not, I'll jump back into mine and go through some newer examples, if that works for you.
Okay, so, and keep in mind, he mentioned newer examples, and he's right, the questions evolve and change, but keep in mind that 5 different services can ask you the same question worded 5 different ways.
Mm-hmm.
The theme will still be the same, right?
Yes.
One service may ask you a mental health question, and another one might ask you a definition of resiliency question. The themes are pretty much going to be the same.
Mm-hmm.
The biggest thing I would tell you is this, guys. Services with as many paramedic students are flooding the field right now, even with as many paramedics are required, okay? Services have the luxury of turning you down, okay? Remember the fine points. Research the crap out of that service in the city, okay? Know your resume, and I've given you sort of a context as to what you should be looking at, okay? Your resume is your handshake. If you're submitting, I don't know if all of you have applied for services yet or whether that is pending, but when you're applying with a resume and a cover letter, listen, I've been doing resumes and cover letters for 20 years. I'm not good at much, but I give good word, okay? I can do a resume really, really well. I'm an English major. I know the lingo. I'm working in the job. I do really good resumes, but they're labor intensive, even when I know how to do them that well. Mm-hmm. So on your resume, you need to make sure that you don't put a certificate on there that doesn't have the full name of the certificate on there. Okay. There's a whole bunch of I'm not going to give away all my trade secrets because that would just be unfair to myself. But when you put your resume down, make sure that if there's a certificate that's on your resume, don't word it like you want to word it like it's worded on the certificate itself. If you put a certificate on your resume, speak to it. If it's outside of the general, what you would get in school, speak to it, reference it, okay? When it comes to your cover letter, make sure your cover letter is service-driven and service and competency specific. Mm-hmm. So again, in the jobs, what you should be doing is taking the jobs you've done previously, pulling out the core competencies from that, and then mirroring that to the job description of a paramedic, okay? When you do your resumes, the second thing is, most people don't do them, they're incomplete. So I'll look at someone's resume, it'll have 3 bullets of what they did. And I'll look at them and say, so this is what you did all day? Oh no, I did this, 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 and this. Then why aren't you speaking to that on your resume? Mm-hmm. If you're gonna put something on your resume as a license or a certification, mention it in your interview. When you're doing your cover letter, if you live in that region and you've worked, played, and gone to school in that region, highlight that. Services right now want to know that when it comes to retention of candidates, if you've lived in that city, I would put, I've lived in the city all my life. I've gone to school here, I work here, I play here. I plan on being here from recruitment to retirement. Because in this current climate, you really have to show them that you're into them when you do that, okay? The other thing is, when it comes to the interviews, and I feel like I'm kind of all over the place, but I'm trying to make sure I round it out before I give it over. You'll notice just now, before I spoke, I took a pause. Okay. One of the most important things you can do is take a tactical breath. Okay. And it really is a matter of military. This is just what they do without even thinking. Police, tactical guys, they do it not even thinking. It is taking that grounding breath to formulate your thought before you say it. Okay. Try and make sure, and listen, people, if I asked you all to take a breath right now and hold it for 3 seconds, you'd all go, oh my God, that was forever. I can't do that. If I was to take a breath right now, I want you to consider what that would communicate to you non-verbally. I understand your question correctly. So no matter what hamster is on the wheel going around inside, I look composed, right? It's this communication of composure. And it shows that because remember, if you've been in my classes before, we talk about the fact that nonverbal communication speaks as loudly or louder than verbal communication sometimes. So take that cleansing breath, compose yourself, take the time to write down a note or two because you will have that option, then put your pen down, take another breath. Okay. Even it just sounds like I'm in control. Soften your voice. It just sounds like you're in control, but speak intelligently, reference the stuff that you should from the field of knowledge that you have from being in school. And then I would also make sure that you want to consider, a lot of times they will ask, say at the end of your interview, do you have any questions for us? Probably a good idea to have a question. Don't ask them, well, how soon will we hear back from you? Because everybody asks that question. Okay, I've got a whole bunch of questions in my head that I would suggest, but I don't want y'all walking into the interview using the same question.
Yeah.
But it should be a question you think of. My daughter is 13 and just did an interview to get into an art school. She just got in, I found out. But I said to her, I said, at the end of your interview, Lennox, they're going to ask you a question. Do you have any questions? I said, these are a couple of questions you can ask. Okay, so think about that as well. At the end of the interview, it's always a good idea to ask them a question. As I said, I can give you one or two now, but then you'll all scribble them down madly, and then you'll all answer the same question. And I don't want that, because that in my mind would negatively affect your process. So I think probably good for there, Kyle. That's kind of the abridged version. So
yeah, that
I'm
was
willing to support you in any way you can with your questions.
fantastic. Okay, Joel, you pulled your mic down. You have something to add quick, and then we'll jump into a few.
No, I think Leslie pinned on it. The tactical pause is important, and that it's important to is certainly in patient care, certainly in life. Leslie referenced dating. It's important to have more than one move in dating as well. So the key is have more than one way to buy yourself some time. Have more than one way to let your brain get caught up with what's going on. Because as Leslie said, same thing. I work in a high stress environment. I like to believe that for the most part, if not at all times, I can manage my stress appropriately. Interviews are terrifying. I hate talking about myself. I hate being, I know I'm doing it now and it's causing myself a degree of stress. I hate being in a situation where somebody says, tell me why you are the person out of all of these applicants that we should hire. Because I try to keep a degree of humility, and I don't think I'm a better candidate, but I want this job, right? So have more than one way of allowing yourself that moment to really formulate your response. Breathing is important. Breathing is good. We all need to do it. I recommend doing it at least 16 times a minute. Try to have, if somebody asks you a question, a nod is important. Acknowledge, don't just stand there and stare at them. Acknowledge that you heard that they said something, that they've stopped talking. If you need some more time to digest the question, you could even say, okay, you asked me whatever question. What do you mean specifically by that? So if they ask a question on patient care, and you're not sure if they're asking about a directive, you're not sure if they're asking about what would you do in this circumstance. When you say what would I do you mean what would I do in terms of applying one of my protocols, or do you mean what overall should I be concerned about with this patient? You know what they're asking. You know that, I mean, you very well may know that they're asking about a directive, but you're doing two things. One, you're saying, okay, I'm engaged and you are giving me something. I'm respectful of your time and I want to make sure that I understand what you want from me so I can give you a good response. But two, more importantly, you're essentially stalling, but you're stalling in a manner that it still shows that you're engaged, it still shows that you're part of it. Another thing you can do is if you have a very complicated answer, you could pick out two key things to say, okay, that's a difficult question to answer, but there are two items that I want to identify in all that you said. So at first you had mentioned X, Y, Z, and then you would answer and you'd speak to that. Secondly, and most importantly, you said 1, 2, 3, and my thoughts on that are whatever is appropriate to your situation. But it's also, as Leslie said, if she gave you, here's a question you should ask. If you always have the go-to of take a breath and hold it for 3 seconds and then start answering, as an interviewer for myself, it's infuriating. If I ask somebody and I know it's going to be a good 3 to 5 seconds before they tell me anything, I'm going to get fed up pretty quick. So definitely do it. Definitely use it. It's a good tool to de-stress yourself, but don't make that your go-to before you have a response for anything. But conversely to that, don't feel that you need to have a response immediately either, because some people start talking and they don't know what words are going to come out next and they don't know where the sentence is going, and we'll just kind of see where it takes us.
And
Appropriate either.
the and the are the two killers. They really are. As Leslie mentioned before, the people who are interviewing you are people who have been in these positions for a long time, have worked their way through, have garnered and gained a lot of respect, and don't expect you to absolutely have all the answers that they have over their career, but they want to at least know that you're a strong pillar and a good starting point. So if you can't even have a simple conversation to answer a question without eyeing and using all this inappropriate vernacular that a lot of the younger generation realistically uses right now, that's really not a great thing. But you're not in the younger generation, so that's okay. So the youngest generation that might be in the group right now or watching at home, all of those terms and those things are just, you want to make sure that you're speaking to who you're speaking to and you know what you are doing. Speak with respect, speak the English language properly as best as you can. Obviously, if it's a second language, that is a completely different story. And that becomes part of who you are and your identity. And the interviewers will respect that as well. So just wanted to hit on that too, is just knowing that what you're saying is appropriate. Don't and stumble. Take your time, take a moment, calculate your little points and go for it.
And I mean,
Just
just
to add on to that, sorry, Joel.
Please go ahead.
So just to add on to that, one of the, and this is not, I'm not upselling, but one of the things that we do, why we do at Medic, I'm just include myself in Medic Sense, I didn't mean to do that, but we do at Medic Sense is we also do one-on-one interview prep, where we will actually walk you through the questions. I will work through your resume with you. I will tell you the things you want to be pulling out. The other thing is, I will also videotape you while we're doing sample questions, so you can actually see your fidgeting, your twisting, you're looking up and all the way around. I'll even everything from, if you look right now, even if you look at me, I'm looking kind of off to the side right now, because generally speaking, I'm looking at the two people, but they're not centered on my, now, see how I'm looking straight ahead now? Little subtleties like that make a difference in the nonverbal communication that we just don't have on a screen. The other thing I will say moving forward is, guys, don't be afraid to show your personality. Okay, remember that the people that are interviewing are seeing how many over a period of 2-3 weeks are interviewing what, 200 candidates. Show your personality, because your personality is part of what sells you as a professional.
Yes.
Don't be afraid to. And
I would love to, but I really need that job.
Yeah. And see, and then I think everyone's able to pull away from this, just that we've been having a discussion for the last 3 hours where this isn't a robot, this isn't a robot thing. Like, yes, we're going into a job where you're in uniform. You have to be presented. You have to be presentable. But even when we're having these discussions with you guys, we're making these little jokes. We're having that little bit of fun. And we're hoping that you guys are feeling the same. Maybe if you even smile and giggle without your camera on, it's that little bit of lightheartedness. Yes, it is important for you guys, and it's maybe easier for us to joke and laugh and stuff about this because we're in these positions that we're in. So we're not trying to downplay it, but for you guys too, have fun with it. You wanted to be a paramedic because you wanted to enjoy it. You want to drive the truck fast with lights and sirens on. You want to be the person that that little kid looks up to. Like, I have had so many fulfilling moments just with those people interactions. That's why you guys want to do it. It's not because of the everything. Oh, if you think it's hot and sexy and amazing to be a paramedic in Ontario right now, you are completely off. You are completely off.
work.
It's
It is
so much
work.
work, but it's so rewarding. So remember why you guys got into it. It's hard for this 2 years or 18 months or whatever school you're at. It's hard to get hired, but it's so worth it. So have fun, stick to it, use the resources that exist, and enjoy yourselves. So let's jump into a couple examples if you guys don't have. Yeah,
one
you do,
tiny
Leslie.
last
Yep.
thing, Kyle.
Yeah,
I'm sorry,
please.
sorry.
No,
Guys,
please.
I am a 53-year-old retired police officer, and when I speak to the people in your services, I address them as sir.
Mhm.
I would
And-
address people by their rank until they tell me not to.
Absolutely. And that was
And
the
even
point
if
I
they
was
tell
gonna
me
touch
not to,
on.
I will still probably call them sir.
Mhm.
You got to remember something. You again, by calling someone sir, I call people sir and ma'am. The guy came in to change the phalange on my toilet the other day, and I called him sir, and he kind of like this.
Mhm.
You got to remember something. You are showing by referring to somebody as sir with love and respect. It appeals to their ego, which is not a
Mhm.
bad thing.
Mhm.
And two, it in that simple word, it communicates your understanding. This is a rank and structure.
Mhm.
If they say to
Definitely.
you, no, listen, Trevor, do me a favor, don't call me sir, call me Leslie. I
Okay,
personally would
thank you.
say, I appreciate that, sir, but when I'm hired with your service, I will
Yeah.
call you Leslie then, but
There
until
you
then,
go.
sir, I would respectfully call you by your rank.
Yeah.
Absolutely.
Okay,
And so
Awesome.
that was the point that
just
I
something
wanted
to
to make.
consider, because some of them will try and keep the environment very casual in the interview. What some people run the risk of is if the people in your interview are keeping it kind of cash, some people can get too comfortable with that and take it too far.
That and
And then
it opens the floodgates, and you're going to
Sure.
say the
So
wrong thing.
where you can,
Absolutely.
if so and so shows know who you's going to be as soon as they sign on, you know their name, you know their first name. I would
Yep.
address them as sir or ma'am until they tell me otherwise. And if I
Mhm.
slip up and call them sir again and they ask me, I will say, well, with respect, until I've passed my probation with your service, I'd prefer to address you by your rank.
Yeah.
Professional
Awesome.
It's a
boundaries
sign of
is
respect.
critically
And the people that
important.
are doing the interviewing deserve it. They've earned it. They eat it up, and it shows your understanding of the rank and file. That's
Mhm.
I'm done.
Yeah, while Coslo in the next one, the professional boundaries are critically important. And I think Leslie is probably going to agree with me with my next statement. And this is what I wanted to touch on. So I'm glad you brought it up. I work with doctors, I work with specialists, I work with very, very highly educated, very, very smart people. I still will address them by their rank if that's appropriate. My mentor, she is a doctor. I've worked with her for 3 years. I have a professional relationship. We are friends. I'll call her bruh, or I have nicknames for her and things like that, which I'm sure she wouldn't like me. They're nothing bad, but she doesn't like the nickname. But it was we chat in front of a patient. She is still Dr. So and so, or she is by rank or whatever. And it's knowing that professional boundary again, because unfortunately, there is a very, very, very fine line between familiarity and unprofessionalism and disrespect. And that changes in your context. Again, if you're in front of your patient, Kyle's not, hey, bro, grab me the IV kit. He's, Kyle, could you please pass me the IV supplies?
Mhm.
And you don't know the supervisor who's not going to appreciate your calling you by their first name, who is
That's
going to
exactly
have
it.
bought into that rank and file so much that you will never be able to address them by their first name.
Mhm.
So those are just things to consider.
Absolutely. Okay, so hopefully we have a couple volunteers for these ones, because we'd love to. We don't have a ton of time left, but as we said earlier, we want to get through the examples that we had present. So, question number one. So this has actually been present on a couple recent interviews. So whoever wants to answer this, do you feel that paramedics have a duty to volunteer their time off duty to help people within their community? If no one jumps in the next, say, 10, 15 seconds, I'd love to hear an example answer from either Joel or Leslie.
I'll take a stab at it.
Yeah, who do we have?
Samantha.
Hey, Samantha. Yeah, please. I'd love to hear an answer here. So do you
Let's
feel
see your
this
face,
way?
Samantha. Let's see
Oh,
your
goodness.
face, Samantha.
Okay, ignore if my children come running in, okay?
Let's see your face.
Most of us have children,
There we
so
go.
it's definitely
Yeah.
okay if they do. We get it. So
I had
please.
to block out the sound and everything, so there you go.
Awesome.
So I think that's a really great question. I don't think that we have a duty or we should feel an obligation to volunteer. However, that being said, I do think that there are unique qualities for paramedics, and some of those are wanting to help in our community and wanting to make a difference. And I think, therefore, some of those qualities could turn over in the sense that some people will want to have that, but I don't think it should be an obligation.
Mm-hmm. So we, I really like the response that you gave me, and to a little bit of a follow-up for our initial question. I like that you touched on the term of volunteer, and we would never make it obligatory. But what ways do you think that you would be a valuable asset to the community that you can represent our brand?
Absolutely. I think that it's really important that as paramedics and first line responders that we're making a face for the service while we're not necessarily in our uniform. And sometimes by removing that uniform, we're able to better connect with our community. And it reduces the pressure and maybe the negative stigma that comes with emergency response, and therefore the fear associated with it as well. So if we're out in our community and we're making a difference in the capacity that we can as individuals, I do think it kind of plays into that as well.
Yeah, I think so as well. I really appreciate that answer. Thank you. Leslie, your mic, just feedback.
Can I make a suggestion of something to add to that? When it comes to volunteering, remember that volunteering is a face-to-face interaction, right? It's volunteering with people that you don't have a general interaction and familiarity with. It's about learning about the clients that are not the ones that you hang out with every day, right? So I used to have police foundation students, and they say, well, I volunteer with my kids' hockey team. Okay, well, that might get you into heaven, but it's not going to help you with a job, because the youth at risk you're dealing with are not kids whose parents can afford hockey, right? So volunteering is with those, remember I spoke previously about those marginalized communities, the homeless, mental health, all those kinds of things. So your answer was really, really good. And it's not necessarily a duty, but it does. And if you think about your paramedic code of conduct, developing yourself personally and professionally, it is, as you said, creating those partnerships, flying the flag for EMS, and then learning more about the communities that you're not as familiar with, so that it will help you with your patient care when you encounter people from those communities that would not be in your normal realm of experience.
Awesome. Thanks so much for jumping in, Samantha. That was a good answer. We appreciate that. Thank you.
Was a good answer.
Thanks.
Awesome. Okay, so I will read it out, and then if anyone just wants to speak up and start answering, just say your first name, and then hopefully we'll get a good answer here as well. So you arrive on scene to a call. Your patient has had a bad experience in the past with the EMS service, so immediately pulls out their cell phone, starts to begin recording the entire interaction with you and your partner from arrival on scene. How do you proceed? How do you deal with this kind of thing?
Volunteer. This
If
is the
nobody's
time,
gonna
guys.
jump
This is
in,
the
I can go.
time. This is the time to practice it and make the mistakes. Okay. When it comes to scenarios, labs, don't be the person who sits at the back and doesn't volunteer. Get that hand up and get in there and try it out.
Because
One
you're
thing
now you're now honestly dealing with 2 hired paramedics that are working and someone with 20 years of experience of interview preparation. Now's the time to
Don't be scared.
get
Yeah,
feedback.
one thing I love about training, you'll make mistakes and there's no consequence. It's made up. It's a scenario. Now is the time to crash.
You won't crash, but if you do, it's okay.
Well, I mean, what metaphor?
Does
I know,
Brittany, does it
definitely.
look like you're about to volunteer, Brittany?
I guess I will. I am in the middle of
Yes.
eating dinner, so just
Great
Leslie
job,
isn't
Brittany.
not answering,
Awesome.
even though I have already. But I guess I could just politely ask them, please don't record me, or if you got to record, just stand back so I can proceed and deal with my call. Maybe if police are on scene, get them to deal with that certain individual, get them to remove them from that situation so I can proceed with my duties. Because it could be pretty distracting, as I have had someone up in my face recording me in a drowning situation, as I was a security guard at a beach this summer. So, and it was pretty tough to deal with someone being in your face and other people asking you questions. Oh, what's going on? What's going on? And it's hard to pay attention to see what you're seeing if someone is distracting you and up in your face. So just simply asking them to back off, and I'll give you permission to record, just don't be all up in our faces.
Yeah.
So
I'm just going to jump in
Yeah,
first
please
on
do,
this
please
quick.
do.
So this is I really like the points that you made, and I'm sure the other two are going to agree that the points that you made are absolutely adequate. But recognize that you're being asked an interview question. You're not giving a point form response on a written form. We want to hear you say, like Leslie was saying, okay, I recognize that this is a X, like kind of identify the theme type thing. I recognize what you're asking me is how I might portray and how I might act if I was thrust into this difficult situation. And I understand that it can be delicate. However, my experience, XYZ, or I would like to proceed XYZ, right? Give it a little bit of a build up, kind of you're speaking to someone asking you a question, right? So tell them and start off a question and an answer, an appropriate answer, not just kind of the point form things, because what you said is absolutely right? It is challenging. And one of the best strategies that you can possibly have is, hey, could you please at least put it down? Or even if you have a family member hold it, we want to make sure that you feel safe, that you feel valued, that you are sure of what's going on, and you have any if you feel that you need evidence for this situation, we want you to have that. But is there any way that someone else can hold it so it doesn't impede my ability to give you the best care that you need right now? Right. And that's what you just hit on the head. You were saying how difficult it is when people are getting in your face. It throws you off. It messes with your mind. It messes with your ability to provide that care.
Definitely.
I think, sorry, go ahead, Joel. Sorry, I apologize.
Oh, okay, no worries. You're the expert on this, so why don't you take the floor?
Trevor, I know you said you wanted to answer that in a second. So there's just something I want to just add to this is, if they change this up at all, and it's the way Brittany answered it with other people filming the patient, this would be also a privacy thing, because you have to make sure you protect the privacy of the patient.
Yeah.
And so, you would want to explain that to the person holding the phone. But the first thing I would want to address is the fact that they've had a bad experience in the past and acknowledge that. Right?
Yes.
Because that is something you are now, as the medic making contact, you are now going to have to undo, basically, with your conduct and your performance, what that other experience might have been. So the first thing I would probably want to do is acknowledge that experience before I continued before that, and acknowledge the fact that that might create a challenge or a barrier to that person trusting you, and it might affect your assessment. And so again, use that as sort of as a basis when you're answering that question. Trevor, you had some suggestions.
Can you hear me?
Yep.
Okay. You pretty much, you said everything that I was going to say there. I think that you're kind of arriving to a bias because they have had that bad experience. So the first thing I'm going to do is acknowledge it. If they are the patient. If they're not the patient, they're just kind of like an onlooker, I would, try and, make the point of, for patient privacy, I would ask that, maybe we don't record. But, if it is the patient, I'm just going to act with confidence. I'm going to introduce myself. I'd like to get to know why, or explain to them, like, we're going to have a different experience this time around, and just make sure that they feel comfortable, because I'm trying to provide care to them as a patient, and just kind of like break down that barrier and that wall that they have just through my actions, knowing that I'm going to do a good job. I'm going to provide the best care that I can, be inviting, and just try and break that bias.
I like that.
I think you said some good things. The one thing I liked that you said the most was, acknowledging to them that you're going to try and make this a different experience. That's phenomenal.
We will do better.
Yeah.
I recognize that something happened that wasn't appropriate, and we will do better this time. And I'm going to build that trust through this interaction.
Absolutely.
Very good.
Absolutely. Before I offer my input, Samantha also wants to share a different perspective for this question. So Samantha, the floor is yours.
Thank you. I definitely think that Leslie and Trevor echoed some of those thoughts that I was having as well. But I definitely can see where Brittany's, I think it was Brittany, I apologize if it wasn't, I think that was her name, where she's coming from as well. And obviously her experiences play factor into this as well. But I do think it's important that you know, similar to we were talking about in the volunteer question, we are that face in that moment, and the actions that we either do or don't do can play a factor in how we're perceived later on, not even just in this interaction, but later on, as we've kind of just discussed. And I agree. I think I would first acknowledge that I was terribly sorry that that was their experience, and by no means should that have been their experience and their feelings. I think it's important to validate that, and then make that attempt at saying, you know, we're going to ensure, or we're going to do our best to make you not feel like that after this, and encourage them to speak up if there is anything along the interaction that makes them feel uncomfortable or what have you. And then kind of relating back to what Brittany said, understanding that if at any point things kind of go sideways, that we do have allied resources that we can call in for support to ensure safety of not only ourselves, but also our patients and our bystanders, and kind of bringing that all together. Coming back to PHIPAA and protecting the patient, if it's a bystander, that kind of thing. But just giving people the validation of, you know, your feelings are accurate, they're completely valid. I'm very sorry you have that, and let's see what we can do about changing that interaction and therefore your future values or views. Sorry.
Really, really good.
Yep, definitely.
I like that. Two things that I would offer for this scenario. Ownership is huge. So by expressing, like Leslie said, I'm terribly sorry that that you've had this interaction in the past. You're free to record this, but I want to make sure that that's not going to get in the way of providing care to you. That being said, though, I want to make sure that this isn't repeated for you in the future. Take ownership of that situation. That's your service. Nobody knows that I'm different from Kyle. They just know that there's a paramedic that says, you know, whatever shoulder flash we have. Okay, we're a uniform, one form, shape, same person. It might as well be. The other thing is, this is a great opportunity to highlight that you are an ethical decision maker. Okay, so my answer, I would include somewhere into this that, quite honestly, I mean, I don't necessarily love the idea of being recorded for my own privacy, but to me, I strive out to provide outstanding patient care, whether there's a camera or not. And I believe that, you know, whatever interaction I have with a patient could very well be used as an example later on what to do, because that's the level of care I aim to provide with every interaction that I have.
Yeah.
And I am not nervous about having something on film that may be used later in a context of legal matters.
Yeah, and that's a huge thing to do. So if you have this type of situation, a lot of the time it's just to build an agitation, right? Because you don't know what that bad experience was before, or even if they had a bad experience, maybe they're just trying to get it for the gram, right? Like, oh, everyone hates paramedics right now, and this guy, they took 3 hours to respond, and now I'm so angry, and just trying to get you on camera doing something silly, right? Lawsuits are options. That mentality of the US is moving into Canada right now, to be honest, as we're seeing with lawsuits and charges and things like that. But if, like Joel just said, if you're competent and confident, oh, okay, if you please, you have all the freedom to record this. You are the patient. You are clearly not violating any privacies for yourself. So if you want to record this, here, can you just hand it to someone so I can do my job? Any questions you have, I'm happy to answer them. Everything can be recorded. Like there shouldn't be anything that you're really scared or worried about if you're doing your job properly, right? So
and let's be honest, guys, there's nothing wrong in an interview with expressing the fact that would annoy the crap out of you. I mean, I wouldn't word it like that, but the reality is we're human. But we know right now that in this current climate we live in, phones are everywhere. Paramedics are under more, first responders are under more scrutiny than they ever have been before. Every chucklehead has a camera, is going to throw it in your face. There's nothing that you can legally do to prevent them from doing it. Is it annoying? Absolutely. And in order to be real in your interview, I would say, you know what, that would probably be really annoying. But in the current climate, it is really to be expected. So, you know, one of the things I want you to consider when you're answering these questions is, again, this is not a recipe card for every answer you're going to be. You're not going to be just rhyming this stuff off because it sounds right. You also have to inject yourself, how you're thinking, how you're feeling. If somebody's, and I'm going to use a bad word, it's a bad word. If someone's standing in front of me calling me a nigger in a uniform, and I've been called that name a million times in uniform, when I've been called that name, do I want to reach into their ancestry, pull it out and shove it up their butt? You're damn right I do. But at the end of the day, I have to remain professional. My job, this is an ambassador question. This is a conflict management question. This is an emotional intelligence question. Self-awareness. If that's going to get you pissed off right away, it's okay. But you want to communicate to them because they want to see how you're going to react in this situation for real. So is it going to piss you off? Yes, it's freaking annoying to have people's cameras in front of you. That's going to annoy the heck out of me, to be honest. But I know that in this current climate, that is the world we live in. I know the first responders are under more scrutiny than other people are, but my job is to make it work. I know that that is a reality of the world that I work in right now. And my job is to use emotional intelligence to make sure I remain calm under pressure, don't get pulled into some kind of conflict, because as Kyle said, there are people that are fishing to get a first responder in trouble. But acknowledge that. It's okay to acknowledge that would be annoying as hell, right? But then, so then you're showing that you're not showing that. Well, I would find that very offensive. They know you're a real person. They know you have emotions. They know you're considering consequences of your behavior by saying, yeah, that's going to be annoying. It would be offensive. It would feel like a violation of my privacy. It would be annoying. But at the end of the day, this is the climate of the world we live in right now. So my job is going to have to be to make that work. And if they're pulling it out because they're saying they had a bad experience, then my job as a first responder in that uniform is to make that relationship work, build that trust. So can I prevent them from taking their phone out? No. Can I ask them nicely to put it away? Sure. If they say no, okay, you know what, ma'am, we're going to work around that. Okay, so
Figure it out.
it's what I want you to remember with all of this. Remember when I say to you guys, these are behavioral interviews. Behavioral interviews are based on your behavior. They know you're not going to walk in there and go, well, I'm going to make this work. They know it's annoying, but be mindful how you communicate that. But wherever you can, if they're asking you a question about someone standing in front of you screaming and yelling, you're going to go, yeah, that's annoying. Yeah, that bothers me. Yeah, I would love to be able to say something. But when I wear this flash, I represent something bigger than myself, aka the Paramedic Code of Conduct. Shall merit and encourage the, okay? So again, whenever you answer a question, I don't want you to read verbatim or memorize verbatim the words in the Paramedic Code of Conduct, but I want you to factor or fold in like a recipe those concepts into your answers. Because the answers for this question is in your Paramedic Code of Conduct. Correct? So talk about what you're thinking and feeling, talking about how you acknowledge what is going on, talking about how you manage that patient, talk about your understanding of what's required of you in uniform to manage this kind of crap, take it on the chin and keep going, and then reference your Paramedic Code of Conduct so that they understand, you understand why they're asking this question in the first place. Okay?
Exactly. Awesome.
I feel like I just preached on that one. Sorry. We went to church on that one, kids.
A little bit of Hosier action.
Right?
Take
Well,
me
I'm
to
glad you
church.
put, I'm glad you put sure on the end of that. I
Amen.
got a little concerned when I put putting the hoe on that one. Oh no.
So we really touched the gender and race stuff earlier in the actual presentation about how to kind of control some of your biases. So I think that we made a really good point on that one. So I don't want to tie up too much more of everyone's time because we are over the end now. But this one I think is really important as it talks to that self-care, that resiliency, but also how you're able to propel and really sell yourself with some things that you guys might not consider as assets. So if anyone's ready after I read out this one, please feel free to jump in. But name an extra.
The teacher me wants to come for somebody. That's what I do. I pick them out. If they don't answer, I go for them. Can I?
You can choose one, and if they say please no, we don't want to put anyone under the pressure too much.
That's okay.
But we do, but we don't. I want to. All four of us want to, but you know the current climate that we live in.
Get your money's worth, girl.
Name an extracurricular activity that you've participated in regularly or at some point in your life that will benefit your career as a paramedic. Let's go, Caitlin.
Be bold. Bueller.
Just figuring out how to turn the mic on, probably, and go.
I feel like she's there.
She's there.
Is Liam ready? Liam, are you ready? I feel like Liam's ready. Oh, Liam. You were my students. I would be marking you all absent by this.
I will. Here's what I will
Caitlin,
do.
Liam.
While somebody steps up to the plate, I'll at least offer my input where if you volunteer with St. John's Am, or if your idea of something that will benefit your career as a paramedic is patient care or first aid related, you finish the college course, they get it. They know you can start IVs, they know that you know what drugs to use, et cetera, et cetera, et cetera. Think laterally. Think about something you love to do for you in your personal life that you can bridge over.
Yeah,
And this,
personal
guys,
life.
could be this could be anything from running marathons, travel. It could be a course you're taking online towards a BA. It could be, it really doesn't, I think everybody kind of goes, well, it has to be like resume related. It doesn't. It is anything from your knowledge base, your skill set, your fitness, your self-care, how you take care of yourself,
If nobody wants to
mentoring.
answer,
I guess I'll do it.
okay, go for it.
Okay,
do we
Brittany,
got?
do you want to, Brittany's one of my students. Do you want
Brittany
to sound a
again?
little bit more confident than that, Brittany?
I'm gonna go downstairs because people in my house are starting to get to bed. Just one sec. I'm not confident right now, Leslie, because I gotta get ready for work too.
You should be most
Confidence.
confident then. Get your game face on. Let's do this.
Here's the problem. You've been in my class and we've done this, so I got expectations.
Hey, this is my third time answering today. You should be proud of me.
Yeah, good girl. I am proud of you.
So I do volunteer at Big Brother Big Sister, and should be just starting with St. John Ambulance soon, shortly too. So for sure, I was in St. John Ambulance before, like all the way back in high school. At this point in time in high school, I had no idea that I wanted to be a paramedic. But as what I remember, the skills that I used to be taught with St. John Ambulance would benefit being a paramedic, because it's also almost like real life scenarios and situations, and depending on where you're placed for volunteering within that, you can get plenty experience. As in, if you're at a carnival, if you're at a, let's say, Merrittville Speedway, and something happens there, you can get like hands-on with a trauma. It'll help you deal with a trauma situation, or who knows, at a carnival, maybe someone's on drugs or heavily intoxicated. That can specifically, I guess, help you understand how I could be within a call like that, I would say. With
Okay.
Big Big Sister, I do mentor a male specifically. Himself, without break confidentiality, he's had a really tough life, so he doesn't really trust people helping him. So it took me quite a long time to gain his trust. So someone who might be, let's say, maybe a specific call that might be triggering for someone, for them to come forward to get help, even something like a suicide call. Specifically, I'm not going to go in too far, but I've dealt with some friends of mine that have been suicidal, and I've actually shown up to that situation, and I've greatly helped that individual. That's not even like, that's just like that's not even a curricular activity or anything. It's just like me helping with that situation, because I know how hard it is sometimes to go get help or to speak up and say you want help. So just dealing with certain situations and how my lifestyle has been, I could probably relate to a lot of people when I'm arriving on scene, specifically of what they might be dealing with.
Okay.
Good.
I really like the points you're making, and I hope that this doesn't come across poorly at any means. For two good feedbacks, and I'm sure other people will jump in. Don't include St. John's. Like, don't give that entire talk about St. John's. If they see it on your resume, say, yeah, I did St. John's experience. It was great. I did it for this amount of years. A majority of the people, as soon as you say, I volunteered for St. John's Ambulance, they know exactly what that entails. They know the skills, they know this and that. If anyone has a different thought process on that, like Leslie, if you think maybe it is good to hit on, that's then give me the reason why type thing. But then the next one, I really like the Big Brother Big Sister. Like, it's something that you're taking on outside of school, outside of paramedic education. It shows so much like drive and like everything that you could do with that. That's awesome. But then build on that.
From the beginning of our match until now, he's actually changed a lot.
Yeah,
to
and
If I
sell
can-
that and hit
if I
that.
If I
But
can
then-
offer, for the big brothers, how old is he? Or what age group is he in?
He's 8 years old.
He's 8. What that does is it gives you a familiarity and understanding and compassion for young kids so that you'll be able to translate that to your patient care when you're dealing with young children, especially acknowledging that trauma that he would have been through. That gives you an empathy and understanding that a lot of medics may not have.
Yeah,
So
he's got
I would
special
get
needs,
rid
plus
of the
he-
St. John ambulance and that answer altogether, and I would strictly focus on what you were challenged to learn about that 8-year-old. Not what he learned from you, but what you were challenged to learn from him.
His
Okay.
behavior is really bad. Like he's got quite a bit of mental health issues, and plus he's autistic as well.
But you had to learn patience with him. You had to be creative with him. You had to be a good
Definitely.
listener with him. You now have a better understanding of children who've experienced trauma or maladaptive behavior. And now that will translate into your interactions with children, either as patients or as bystanders to their parents when they're patients. So that's what I would pull out of that, is I would get rid of the St. John ambulance altogether, and I would strictly focus on the volunteer. If you've also been with, how many years have you been with him?
I'm going into my second year. I just hit second year. Yes.
So speaking of the fact that you've been doing it for second year shows commitment. Articulating your understanding of why that commitment to him is so important, because it is an investment. So these just little trigger things that I would pull out and then you have to really articulate where that translation is going to be in your paramedic job. Communication with patients. That's an age group and a gender that is not your own. And you may work with people who don't have kids. So how is that skill set? What you got from that, what he taught you, how are you going to translate it into the job? That's what I would focus on. Because that's a phenomenal thing to speak about.
It is, and that's a huge thing that speaks to your not only your ability to be a good paramedic, but you as a person. And that's what we said the interview is all about, is portraying your own who you are more than what you're going to look like in the uniform and who you're going to be in the uniform. Christine, you have a comment on this?
Christine, hi.
Hi, everybody. I've been sitting quiet in the background here. So mine's a little oddball. I ride a motorcycle.
Oddball's good.
And I love to tour all over the place with it. I have a nice group of individuals that I work with and I go with, and I love it because I get to meet different people in different areas, see how different services operate. One that was really good to watch was up on the Dragon's Tail down in South Carolina. I got to see, unfortunately, people had wiped out on the bends, but I got to see ambulances responding, which was really neat. And it's mental health, right? So there's nothing like 100 kilometers an hour with oxygen hitting your face. So it's wonderful. So yeah, I enjoy it.
Can I suggest pulling out things like a sense of community?
Yes, absolutely.
Okay. The sense of community outside the job, articulating the community you have outside the job shows work-life balance. Okay. Talk about the sense of family, the sense of community, the sense of one-ship. Talk about the travel that's involved. Talk about, disconnecting from everything work-related, and even sometimes getting away, even if it's an hour away, feels like you've been away. It's a change of scenery. So speak about that stuff as well. Absolutely.
Right.
Yeah.
Yeah.
And you have an intimate knowledge of motorcycles that some paramedics don't have. Right.
Yeah. So the whole, if they wipe out, how to remove the helmet thing helps. ITLS helps as well. I mean, that course gives you a lot of knowledge, but
for sure,
it's a different oddball perspective. So
yeah, but and honestly, don't call it an oddball. Exactly.
Okay.
All three of us are here shaking our head like it's not a. When you said I have an oddball one, I'm like, oh man, this is gonna be crazy.
So I would really want to throw in things like contributing to my mental health, resiliency. Like we're not just dropping terms in but you will say it's self-care, but what does that mean to you? What does that actually mean? So
I have a strong support group.
But from your perspective, Christine, articulate what that gives you. So be specific in what it does for you.
Great.
Right?
Awesome.
Thank you.
These have been really good answers and really good perspectives, guys. I think this has been a strong conversation. So hopefully you guys have really enjoyed Number one, the presentation, and thank you so much, Leslie, for being able to come in and deliver this presentation for us and being
Listen,
great with all the
I'm
responses.
pretty
And
passionate about this stuff. I love this stuff. So anytime.
yeah, awesome, awesome. So with that whole anytime offer, it's February, it's early February. So we are in the heart and soul of hiring. Most of you guys have probably written your service testing if you're in second year. If you're not, you're going to be doing this next year or whatever. So be prepared now. Don't get stressed about it. Obviously, just enjoy your life, live your life, know why you want to get into it, have fun with it, right? Enjoy yourself as you're going through college. It's so much different now with everything being virtual. When before, me and my big group of friends after an exam, you could go and grab beers together in the core, right? Like, so just the restaurant on the college. So it's a lot of things have changed. You guys are all dealing with so many different things right now. Just try and enjoy it the best that you can. Get yourself prepared, but focus on that work-life balance. And work for you now is studenting. So focus on student life balance, right? Enjoy Valentine's Day with your honey and don't even think about opening a textbook or the ALS 4.9. Sorry, Leslie. We'll find you someone to celebrate Valentine's Day with, I promise you. You're going to be with your amazing 13-year-old talented daughter going to art school. So damn, that's
Right?
a hell of a day. But in all honesty, just utilize your time for you. We don't just want to, again, throw buzzwords of self-care and resiliency and blah blah blah. Demonstrate it. If you build up these habits now, it's only going to really come through as you become a medic. Because I really believe that every single one of you guys just showing the commitment to actually show up today is showing that you are taking those next steps to take it seriously. What resources can you find that are going to make your journey here better? So with that being said, I just want you guys to be aware of what can be offered, the things that we can do and help you with. Obviously, AMCA preparation is kind of the meat and potatoes that I've been working on for multiple years. The second thing here, we have an online access product that we're going to be launching in the next couple months, which is really huge. We're still looking for some beta testers for that. So if you would be interested in any more information, just shoot a message on the Facebook page, send an email. We're trying to find a couple more people who can help us really smooth this out right before the launch. So it's a discounted access rate. You're going to get all the most recent updates and everything, which is really fun. So that's pretty cool. If you don't have your AMCA already, interview preparation, private and group tutoring sessions with the one and only, obviously, Leslie doing her interview, crushing it with interview stuff, as well as resume review and rebuild. So she can add all of these little courses and little tidbits that are really going to help you shine, but not only shine and look good on paper, but improve your ability to communicate effectively, your ability to deliver effective patient care, psychological well-being, and just be a more of a well-rounded candidate. So that's something that we would love to help you out with. We also do skills and scenarios tutoring. So that can be one-to-one or group sessions, can be virtual or in person. We have a bunch of equipment. We will come to your house and do it realistically. That's how we kind of got started with all of that. So with the monitors and the patients and things like that, as well as academic tutoring. So all of you first year guys, if you're going through anything where you're a little bit confused with things, we're happy to kind of be kind of your little shadow, right? So if you are really struggling with, say, cardiac, and you just can't quite digest how your teacher is teaching it, maybe it doesn't work for you, just reach out and we're happy to do maybe a single session of, hey, you know what, let's give you another way to explain it. Be here to bounce ideas off of all kinds of stuff. So that can be at the ACP and PCP level. So these are all different things that we offer. If you need anything in the future, just let us know. The first thing that we want you to do is, if you have a question of any kind, just send a message to the Medic Sense Facebook page. There's 4 staff, like the 2 that aren't here, plus the 3 that are right now. We all monitor it. We make sure that we're paying attention. And if you have a question, we're going to do our best to answer it. And if we can't get the answer off the top of our heads, we're going to do everything we can to find the people who have the right answer. So use us as a resource throughout your entire process, and it's going to help. Okay. Does anyone have any questions at all? We have a little bit of I want to make sure I open the floor for general Q&A and any closing remarks from Joel and Leslie.
Just before any comments, just to let you know that the part of what I can offer is also, for some of you, I'm not sure how in depth you did all the medical legislation. So we can also do review of all the legislation that you would need for both the AMCA and the service testing.
Awesome. Joel, Did you have any comments that you kind of held on to throughout that made it to the end, or you all good?
No, so I mean, we touched on them. For me, ethics is huge. If there's any advice I can recommend, absolutely take every opportunity you can to engage in ethical discussions with your peers, engage in ethical discussions with your professors, certainly with your crew. Gain different perspectives, get very, very comfortable with the idea of being uncomfortable, because if there's one thing that I can tell you with certainty in this career, you're going to be uncomfortable more often than not. And it's, in order to grow as a person, in order to grow as a paramedic in whatever profession you do end up in, because for some people, paramedic is sort of a stepping stone to move on to nursing or med school or whatever the case is. Take that opportunity to grow. If you find that you're stuck, if you're not growing anymore, now your stress starts to get to you. Now, unfortunately, I've seen employees where they kind of get disgruntled because they're not being challenged, and it's not that new challenging experience that they had when they first started. Try to keep that humility, try to work on basic skills. Again, bring it back to the conversation of ethics. If you're having, within respectful confines, of course, if you're getting into a productive discussion that puts you outside of your comfort zone, that makes you think about things that otherwise you may not have, or you're exposed to someone else's perspective, it may not change your mind, it may not change your views, the way you do business, but at least you can understand where someone else is coming from. And that's so important, because most of our patient presentations, I have not been, fortunately, thank you, like I have not been in some of the crises that are in pretty much any of the crises that our patients find themselves in. But by having insight, by talking to people who have been, I can at least have some kind of understanding. I can at least bring some kind of calm to that situation, because it's not the first time I'm being exposed to it. And then in terms of studying, like Kyle said, we're here to help you every step of the way. I myself, when I'm available, my schedule is very, very erratic, so I'm not always available. But when I'm available, I love nothing more than sitting down, chatting through, helping people understand concepts that they otherwise would not have understood. Another product that Kyle didn't mention, but it's kind of my pride and joy. We do have flashcard decks actually that we're making, and I have been away with work. I've been busy, so I haven't been able to make the latest update as yet. But there are decks that exist that if you haven't checked them out, they're definitely worth checking out.
Yeah, flashcard deck and a booster pack on some of the key topics. So if you're someone who's more tactile, you really can't stand just staring at a screen all day, then we do have kind of that flashcard stuff. They're fantastic. And in the chat, we just had someone absolutely blow up. I have them. They're amazing. Highly recommend them. They really helped. So thank you very much for that quick shout out.
I'm glad to hear that.
There you go.
Just from my perspective, what I really see, and I'm not you guys, the students, but and I'm not trying to blow smoke, but what I really see in the packages that are being offered, and in the skill set that's being offered with I'm going, you guys, not medic sense, is it's very well rounded, and it sort of seems to hit all of the really important components. And what I like about what you're delivering, Joel and Kyle, is you're delivering it from a really want to help you perspective, and it doesn't feel like a package. It feels like you're actually providing a service and support, and you're actually wanting these students to do well. So from my perspective, listening to you guys and what you're offering, I'm really impressed by it. So
awesome. And I hope if any of you guys are like, oh wow, well, they're obviously just trying to make this money and blah 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 and get me hired and this and that, that's totally fine to have that feeling. But at the end of the day, the reason I love it is because a lot of people are going to continue to get hired every single year. People are going to get hired. I want to do what I can to have even the smallest input on getting the best candidates hired, because that's going to make my job easier in the future. If I can trust my partner and that they know they know a lot, they're good at it, they're well-rounded, that makes my job easier. That makes patient care better. Like the entire thing gets better. And it really does start with someone and something. And I took it upon myself to create this. And I have a really great like-minded group of people who feel the same way, that it can start with us by making those changes. So that's realistically why this happened. So thank you very much for those comments, Leslie. It's amazing. And with that, I just want to thank everyone so much for taking the time out of your day. I'm really glad that you guys jumped at this opportunity, and it was great to see you guys all out. So if you have anything in the future, please don't hesitate to reach out. It's been fantastic and just been fun interacting with the majority of you. And best of luck with all of the future steps you guys have ahead of you. Thank you so much.
Absolutely. Good luck, guys.
See you later, guys.
Thank you for the presentation. It helped me a lot. Actually, Leslie knows I'm not one to really talk out and speak.
You're not.
So this was a
Awesome.
whole bunch of confidence filling for me. So
Good job.
Awesome job, Brittany. Great work.
See you soon, girl.
all right. Thank you.
Thank you guys all for getting vocal here. And even the first year, Maddie, I believe it was, first year jumping in on a scenario, like you didn't really know too much of what might have been thrown at you, but you jumped in on it. Treat the rest of your education and treat your preceptorship like that. If you treat your preceptorship the way that you treated that, you're going to absolutely crush it. Start it from the beginning, jump right in, and you're going to have a great time.
I'm absolutely terrified for rideouts. That's for sure, though.
You got this.
Thank you.
Okay, awesome, guys. So I'm going to go ahead and end the recording. Thank you guys again. Everybody have a great night. If anyone has any questions, just feel free to reach out.
Thank you, Kyle.
Thank you so much for coming, Trevor. It's great to see you, man. Awesome.
Good to see you too.